to state their location from which they are participating from. Additionally, all votes will be conducted by a roll call. They would also like to mention that this meeting is being recorded. However, if you would like to record the meeting on your own, just notify us by raising your hand via Zoom or waving at us, and you'll be given access to record the meeting on your own computer. While you can record the meeting on your own computer, the official record of what transpires in the meeting are the minutes kept at the county clerk's office. I would also like to mention there's an opportunity for the public to address the Board of Commissioners. We have a call to the public at the early in the meeting, and we have a call to the public towards the end of the meeting. Under both call to the public, you're able to address the board in 3 minutes. Please state your name and address before starting your presentation. Would like to also remind people that the call to the public is your opportunity as a public citizen to present information that you feel is important for the board to know. It is not intended to be a dialogue between the board and any individual citizen. With that being said, if you would join me for a moment of silent reflection before we get started. Thank you. If you would also rise and join me in the Pledge of Allegiance. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Item 4 on the agenda is roll call.
Commissioner Nakagiri.
Present, Heartland Township, Livingston County, Michigan.
Commissioner Griffith.
Good evening, participating from Genoa Township, Livingston County, Michigan.
Commissioner Lawrence.
Good evening, participating from the city of Brighton, Livingston County, Michigan.
Commissioner Reeder.
Present, participating from Deerfield Township, County of Livingston, State of Michigan.
Commissioner Helserman.
Present from Handy Township, Livingston County, Michigan.
Commissioner Dreck.
Present, City of Howell, County of Livingston, State of Michigan.
Commissioner Zajac.
Present from Marion Township, Livingston County, Michigan.
Commissioner Gross.
Present from Green Oak Township, Livingston County, Michigan.
And Commissioner Plank.
Good evening, present, participating from Green Oak Township, Livingston County, Michigan.
A quorum is present.
Thank you. Item 5 on the agenda is correspondence. This evening we have 2 pieces of correspondence. One from Berrien County, a resolution in support of Senate Bill 127, and then another from Tuscola County. It's regarding participation in virtual board meetings. I'm looking for a motion to place on file or to receive and place on file. Is there a motion?
So moved, Gross.
Support by Griffith.
Motion by Gross, supported by Griffith. Roll call, please.
Commissioner Gross.
Yes.
Commissioner Plank.
Muted.
You are muted, Commissioner Plank.
There we go. Sorry.
That's
Yes.
Okay, Commissioner Lawrence.
Yes.
Commissioner Reeder.
Yes.
Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
Commissioner Dreck.
You're on mute.
Yes.
Thank you. Commissioner Zajac,
Yes.
and Commissioner Griffith.
Yes.
Motion carries.
Item number 6 on the agenda is call to the public. Anybody wishing to address the Board of Commissioners this evening, if you would either raise your hand via Zoom or physically raise your hand and wave at us, you'll be called upon. Just a reminder to please give your name and address before starting with your 3 minutes. I saw Commissioner Helserman with his hand up. I would like to recognize Commissioner Helserman first.
Good evening. Someone asked me to say a prayer tonight. I don't mean for it to be political because I don't think God is political. But I assented to say a prayer. So join me if you'd like. Our Father, we thank you for this day. Thank you for the wonderful world that you've given to us. Thank you for the many different opinions that will be represented tonight. Lord, we just ask that what is true will be said, and that we, as commissioners, will make decisions based upon what's true. We know that we can't please everyone, but we just ask that everybody will say their ideas clearly and concisely so that we can understand them. And we ask that you would give us peace in our county, peace in our country, and we ask these things for Christ's sake. Amen.
Amen.
Cindy Katnick, if you would, take over recognizing this, the citizens with their hands up, I would appreciate it.
Sure. First is Jessica Hamlin.
Jessica Hamlin, if you would, well, we know your name is Jessica Hamlin. If you give us your address, then we'll have 3 minutes.
Okay, I am Jessica Hamlin. My address is 2323 Pleasant Ridge, Powell, Michigan. I am here today because I do not support the extension of the state of emergency. And here are some reasons why. I have not heard any spike in COVID deaths. In fact, the main focus is on COVID cases. And the panic in our county follows those numbers. Now we are dealing with excessive testing on our children to participate in sports. In such a case, the ramifications of, let's say, false positives, even more panic and anxiety is going to be raised throughout our community. A county that has been in-person schooling since August and no serious outbreaks have occurred. Per the Livingston County website, there are 9,916 confirmed cases, 1,201 probable cases, 270 hospitalizations, 150 deaths, 9,869 recovered. There has not been one death in ages 0 through 19, yet they are the ones suffering the most through these mandates. The confirmed case daily change reached its highest November 19th at 273 cases. The last date reported, March 17th, 64 cases. We cannot continue to ignore the effects this state of emergency has on our community. Businesses, job loss, interrupted education, sports, extracurricular activities canceled, financial struggles, hunger, mental, emotional, psychological health issues rising, increase in drug and alcohol abuse, as well as domestic abuse, suicides, crime, and just as importantly, division and hostility between society based out of fear, panic, and misconstrued information. Extending the state of emergency is going to continue or even heighten the hysteria we are facing amongst Livingston County, that the numbers and the data just does not support. Our community should be celebrating all we have accomplished, but instead we continue to take more away from our children, force masks without any exemptions, or even know the long-term effects. Even though industrial hygienists, surgeons, doctors, subject matter experts in respiratory protection advise against it, with a long list of risks I do not have the time to go over, but also that they nor the most of the adults around them have proper training in PPE and how effective the masks being used are to the virus itself. The state of emergency continuing could possibly provide further interruption in their education with quarantines and continued psychological distress we are placing on our youth, making them unsure how to even exist in the world we live in today.
Ms.
We
Hamlin,
need to find better and more effective ways to move forward. Perhaps online signups or larger facilities to accommodate these meetings. Thank you.
Thank you very much. We appreciate your comments. Next.
John Connolly, you're up next.
Thank you, Board. John Conley, Brighton, Michigan, Brighton Area Schools Board Trustee. And the state of emergency concept should only be used when there's an emergency. And if we do think we should use it and there's not an emergency, well, then what happens if there truly is one in the future? And the prior person who made the comments, I'm not going to go through the same list because she hit them all pretty good and reference our youth. And we all believe in protecting our senior citizens and the ones that are more vulnerable. But in our public school system in Livingston County, out of 20,000+ altogether by all the schools, there's in the neighborhood of 400+ cases. And in that 400+ cases, 10% are employees, the other part are students. There's no connection to the cases being from school. So they brought them to school, and that's countywide. And Howell's doing the best job, and they have the biggest school district, and they've been in school 5 days a week. So I would just urge the board not to declare an emergency unless there is an emergency. And in this case, from my perspective and the knowledge that I've gained, and I've done my research, I'm pretty good with numbers. I don't see an urgency. That doesn't mean don't protect our senior citizens and protect the vulnerable and the people who want to get COVID vaccine. I understand that. And I understand both sides, I think, better than most. We all have parents. If we don't, our parents are gone. You know, I have an 83-year-old mother she's on the fence deciding what to do as she returns from Florida. So that's what I have for the board. And I appreciate the board's serious consideration on all these issues. And as we go forward, I think that it's gaining respect in our community. I just would suggest the same. But my position is no state of emergency unless there's a real one. Thank you, board.
Thank you. Next.
Kathy, you're up next.
Kathy, if you would provide your full name and address before you start, that would be appreciated.
This is my wife's computer. My name is actually Randall Beard, and my address is 204 George Street in Howell, City of Howell. Livingston County spends millions of dollars every year to ensure accurate timekeeping. Your central dispatch runs on accurate time to dispatch police and EMS. Your city or your GIS department uses GPS, which requires accurate timekeeping. When you go into the court or the clerk's office, you turn in a document, it is time and date stamped, so it's expected to be accurate. 140 years ago, when the courthouse was built, the clock was put on it because it was very important for the county to function with accurate time. At that point, the time was kept by the railroads. So an employee would go to the railroad station and set their pocket watch to make sure it was accurate, and then go climb the courthouse tower and reset the clock. It has now been more than a week since daylight savings time has taken effect. Yet the courthouse clock is wrong. And this is not the first time that the courthouse clock has not been reset for daylight savings time, both going in the fall or in the spring. I really feel that the Board of Commissioners needs to make it a conscious decision to let county employees know that keeping accurate time is important. You feel the courthouse clock is important enough to make it your logo that represents our county, but you don't feel it's important enough to actually reset the clock. Resetting the clock is really not that difficult. You can turn it off for 23 hours and it would be right the next day. Again, it's been now more than a week since daylight savings time took effect. I would appreciate if the county commissioners would speak to county employees and make that happen. Thank you.
Thank you. Next.
Up next is Danielle Anjo.
Danielle Anjo, if
That's me, Danielle Anjo. Okay, my name is Danielle Anjo. My address is 2833 South Hacker Road in Brighton Township. And I would just like to say that I don't feel that there's a need for any type of emergency to be extended. There's definitely other solutions that we could come together and figure out. It doesn't need to be, the meetings don't need to continue on Zoom. I think it's kind of unfair for those that don't have the access to Zoom, don't have maybe computer access. There's some people that just don't do well through computer. They want that face-to-face time, and I think they are owed that. A solution that I had was maybe finding a bigger facility to facilitate these meetings, allowing for the social distancing and the precautions needed. From my understanding, the place that you guys would hold it might not be big enough for that, might not be able to accommodate that. But if we made a couple of changes and secured a different location, I think that that's still doable. I don't feel that there is an emergency. If you look at the actual data, you won't find it. You won't find an emergency needing to be continued. So that's just how I feel. That's how a lot of the residents feel that I've talked to, people that want to be included in these meetings. I personally also do better face-to-face. You see people's gestures, you see people in person, you get to know them. And as people who are voted in by us, it would be nice to be able to have that contact, have that in-person experience. So, and that's really all I had to say. Thank you.
Thank you very much for joining us.
Elizabeth Johnson.
Elizabeth Johnson, if you name and address, you have 3 minutes.
Hi, I'm Elizabeth Johnson. My address is 4625 Spring Mountain Drive in Brighton, City of Brighton. I just kind of want to echo what Danielle had said. I do not support extending the state of emergency. I think that there are too many negative ramifications that it can have on our community. And with the stats that we are now well aware of, it doesn't scientifically back up to keep extending it. I think that we, as a county, are doing amazing. Our schools have been doing amazing. We're, people are looking at us from near and far. And I think that us saying, look at us, we're doing great, we're doing awesome. And then to say, but we're extending our state of emergency doesn't make sense. Like some other people shared, I'm also concerned about the effects that it's having on the kids. And going forward, I would, we're pushing to get back to a normal school year. And I think that we need to seriously consider what extending a state of emergency will do to our kids. That's my basic concern. There's lots of ideas Danielle shared, making bigger things. There's lots of ideas, but I think we need to think outside of the box here. You know, there's some great options, and I think we need to look further than just extending. Thank you.
Thank you for joining us.
Judy Daubenmire.
Hi, my name is Judy Daubenmire, and I live at 4490 Lakeshore Court, Brighton, Michigan, in Genoa Township. And I would urge you to approve the state of emergency. This has nothing to do with schools. This has to do with the ability of local governments to continue to hold meetings remotely. This doesn't affect just the county commission, but many water boards and other entities that have small meeting rooms where it'd be very, very difficult to socially distance. This would be very dangerous to people if people needed to come in person to voice their opinions before local government, if they have not been vaccinated yet, or if they have an immune suppression problem. This has nothing to do with local schools. This is an emergency declaration that's put forward by our Department of Emergency Management. And I think they are the best people to judge whether it's something that's needed in our community. And I would urge the commission to approve it. On another topic, I do want to remind the commission of my remarks during the Finance Committee regarding the $37.2 million that the county is receiving from the American Rescue Plan. And I hope you will be creative in finding ways to allocate that money so that we can help heal our community with local businesses, nonprofits, and so forth that have all been impacted by COVID. Thank you.
Thank you, Ms. Daubenmire.
Rick Naper.
Hello, can you hear me?
Yes.
Yes.
Okay, I just want to say that I think the Board of Commissioners should not extend this emergency crap. I'm just going to call it what it is, because this is a bunch of BS. My mother died from COVID. Yeah, COVID's real. But what killed my mother was the fact that she was treated for pneumonia instead of COVID. That's what killed a lot of people throughout this so-called pandemic. And I think that a lot of governments are hiding behind it and having all these Zoom meetings, which makes it very difficult to get anything done or for people to voice their grievances. We've been shut down way too long here in Michigan. As a result of my mom's passing, I've had to make multiple trips to Florida. I've been there approximately 7 times since April. They're fully open. There's no mask requirements. And by the way, I've been treated very badly in the last few days by people because I'm not able to wear a mask. But I've been to Florida. They're fully open and everything's normal. And then I come back to this nonsense and cannot believe the way people are acting and behaving over, you know, like it reminds me of 2nd grade when boys and girls would say each other had cooties. It's just ridiculous. And Florida has 1,000 people migrating to become residents of Florida per day. And we're losing people from this state. Businesses are leaving. Everybody's leaving because of the high taxes and the way that government's being run here. And it's time that we get back to work and get back to some normalcy and quit encouraging all this fear that people have. It's just out of control, and I think the Board of Commissioners need to make a good decision, and let's get back to having business as usual and some normalcy instead of continuing this fear. I guess that's probably about all I have to say. There's probably a few of you that are very glad that I didn't win my election and become a county commissioner, because I would be very outspoken. And it's got to stop. If you guys don't stop it, it's not going to get any better.
Jessica.
Jessica.
Unmuted. Hi. Can you hear me now?
Yes, we can hear you.
Okay, fabulous. So my name is Jessica Bearfield. I live at 11256 Country Lane in Pinckney. Thank you for listening to me tonight. I am here this evening to speak to you guys because I am in opposition of extending the state of emergency in Livingston County. Based on a recent meeting, the county administrator Nathan Bird said that there were problems with meeting in person because that would open the doors to the general public, leading to health and safety challenges. In this declaration, it leaves the county in a place of burden of proof. Your board of commissioner needs to prove with science and data this statement is fact if you want to use it to continue with the emergency orders for the purpose of restricting open meetings. Every store I walk into in Livingston County surely has more patrons shopping than your board meeting would have in attendance for a meeting. I would like to ask you all to think to yourselves, do you shop in person? Do you eat in restaurants now that they're open? Do you go anywhere within the general public outside of your homes? If you do, then you clearly are not worried about being around the general public. This move seems to come from a place of personal reasons rather than making a decision for the greater good of the community. Yes, continuing with the state of emergency allows you to continue your virtual meetings so you don't have to come into work in person, but it allows for schools to close more rapidly, sports to be canceled without proper reasons other than we are in a state of emergency. It further harms businesses and restaurants that have limitations placed on them by the state of emergency, creating a trickle-down effect of more struggling families, not only by financial means, but also negative ramifications on their emotional health as well. For what? For a county that had 12 positive COVID cases yesterday? For a virus that the CDC says has a 99% survival rate for persons 0 through 70 and a 95% survival rate for those above 70? It is time to stop making decisions where the solutions are more damaging than the virus itself. Your board is governed by we the people, and we the people have sat by patiently for 12 months waiting for you all to do your jobs properly. That has not gotten us very far. So now we the people are prepared to stand up and use our voices and any legal means necessary to hold you accountable to the oath you took. Article 6 of our U.S. Constitution says that if you are in any of the 3 branches of government, you must swear to uphold the Constitution. Additionally, Michigan law MCL 15.151 states that if you are employed or work for any government, you must take that same oath of office to be employed because you are an employee of the government. It does not allow you to operate on your own personal beliefs or for selfish reasons. Extending the state of emergency is a detriment to our county for your own personal gains, where you have not been able to show a burden of proof that holding meetings in person would lead to health and safety challenges. If Walmart can be open safely, so can you. And that's all I have to say right now. Thank you.
Thank you. Thank you for joining us.
You're welcome. Have a nice night.
Stephanie's Galaxy.
Can you hear me?
Yes, we can.
Yes.
Okay, I'm on my phone then, sorry. First of all, I would like to say my address is 9124 Marion Drive, Brighton, Michigan. I am very happy with our county that we live in. However, I don't think the state of emergency needs to go on. The CDC actually posted on their website not too long ago that only 6% of the people that died from quote unquote COVID were actually COVID. The rest were other illnesses. And quite frankly, if we're going to go off of science and data and we listen to the CDC, I believe that this is what we need to move forward without this mask mandate and without this state of emergency. And quite frankly, it's a virus. It's never going to go away. We have to build immunity somehow, and this is not working. Like other people have stated, there's more deaths, there's more from suicide, more alcoholism, more drug use, more depression, and this is not the way to end it. We have to move forward somehow. They did a study also on states that had no mask mandate and states that did have a mask mandate, and the numbers were similar. So what does that tell you? It literally tells you that what we've done is pointless. There are other states that have done way better than us, and they've never had a mask on. And quite frankly, I believe that I agree with that other gentleman who spoke about people are leaving Michigan. What are we known for? Well, having the worst government there is in America. That's all I have. Thank you.
Thank you very much for joining us.
Aaron Wilson.
Greetings, commissioners. I'm Aaron Wilson. My address is 710 Shepherd Street of Lansing, Michigan. Though I don't live in Livingston County, I think that this state of emergency needs to be ended. After all, we heard what some of the folks said. I completely disagree with Judy on every single point. This emergency is not even an emergency. I mean, let's face it, the COVID numbers are completely blown up. And let's face it, people, we know this thing, yes, it's a real thing. But, I mean, we can tell just by these inflated numbers that something is being concealed. These mask mandates never should have happened in the first place. The way I see it is, if people are worried that they might catch COVID or pneumonia or the flu or what have you, they can stay home. They can wear a mask. They can wear a hazmat suit for all I care. The way I see it is, we should have the freedom to decide for ourselves. After all, it's what our Constitution told us many, many years ago, actually a couple of centuries ago, the better part of 3 of them. And even though I don't represent the county that this board is part of, we're getting hit with the same effects. Sometimes, some even worse than others. I mean, this mandate never should have been put in place. This state of emergency never should have been put in place. I agree with Rick earlier when he said, don't call a state of emergency unless there is one. These numbers, they just don't make any sense, people. Let's end this together. Let's throw the mask, burn them, and let's let our immune system do its thing. Thank you.
Thank you for joining us this evening.
Janine.
Hi, my name is Janine Ayer, and I live at 2396 Brighton Road in Howell, actually Genoa Township. And first of all, I want to thank the commissioners for their service to our county. I'm basing some comments on my hearing of last commissioners meeting. When I heard the commissioners discussing this issue, I didn't hear any facts or data. So what are the facts or data you're basing a declaration of a state of emergency on? There hasn't been, to my knowledge, a spike in COVID deaths in Livingston County. There hasn't been a spike in COVID cases recently, nor did I hear any commissioner cite a spike in COVID hospitalizations in and around the county. Overall, I didn't hear any data, facts, or reality that would justify an emergency declaration in our county. And I feel like others have a voice. We must base a declaration of emergency on fact and reality, not on the convenience of people who don't want to meet in person. It would affect more. It would affect more than people like on government committees. It affects children, as some of the citizens said. And besides that, what other people do with this declaration of a state of emergency, what it might do. It might affect decisions made by nursing homes, like not allowing visitors to elderly relatives. What does that do? It makes the elderly depressed and want to die, and it upsets the family members that can't see their aging relative. What does it do to gatherings for funerals and weddings? It limits it. And this also has more social, mental, emotional ramifications on individuals and families. Now, also ramifications on businesses. Industry impact data show that 5,600 or 33% of Michigan restaurant operators say it is unlikely they will still be in business in 6 months if the same restrictions are in place. And that's what a declaration of a state of emergency in our county would do. 2/3 of hotels, approximately 850 in Michigan, report they will only be able to last 6 more months at the current revenue. Basically, they need to open up fully. 50% of hotel owners say they are in danger of foreclosure. There's some data. I sent this information to the Livingston County email. So the question here is, why decide to bring this fate on the small businesses in Livingston County? My third consideration is, what are other elected officials doing under the current conditions? Elected officials in federal and state levels are setting an example by meeting safely to conduct their legislative and other duties, to my knowledge.
Decide you have 15 seconds.
Okay, thank you. So as a citizen of this county, I personally want to have in-person meetings and be able to attend and participate in in-person county commission meetings per the Open Meeting Act. And I thank you for your attention.
Thank you. Thank you for joining us.
Yep.
Ron Cardos, you're up next.
Yes, thank you. I hadn't originally planned to talk about this, but it seems to be the issue of concern. And I'll just briefly say that I am in full agreement with Judy Daubenmeier in her position about the extending the state of emergency. So, excuse me, I will mention my name, Ron Cardos. I'm from Osceola Township. And I'll go to the issue at which I joined the meeting for. I'd like to read a brief summary of something that recently occurred in our neighboring Oakland County. The Oakland County Commission and Oakland County Executive Dave Coulter have announced that they plan to turn Oakland County green. The Oakland County Climate Campaign is a grassroots partnership of advocacy organizations, environmental groups, and volunteers who are committed to a healthy, equitable, and thriving environment for Oakland County. We work to improve the county's environmental outcomes through educational programs and citizen engagement. The Oakland County Climate Campaign is a project of the North Oakland branch of the NAACP, Michigan Clean Water Action, Oakland County Sunrise Movement, Sierra Club, Transportation Riders United, Moms Clean Air Force, Michigan Climate Action Network, Michigan League of Conservation Voters, Rochester Riders, and more. It would be inspiring to see Livingston County commissioners recognize the need to protect the environment for Livingston County residents. Thank you very much.
Thank you for joining us this evening.
Sean Greer.
Sean Greer.
Hello. Thank you for having me. And I'd like to first off thank the Board of Commissioners for standing up within the community and doing what they can. My foundation is in the roots of the Constitution and getting back to the unalienable rights that we have as people. The U.S. Supreme Court, Marbury versus Madison in 1803, said a law repugnant to the Constitution is void. It has no force of law and can be ignored. As an oath of office for all government and public servants, it's an individual oath of office, as you know, that we have to stand as individuals and uphold to our belief with a conscious mind of what we believe is right. If presented with factual and scientific data that suggests a declaration of emergency, any of that stuff, then that comes with factual proof and science, not fear-based, not in presumption of an emergency happening. You can't make laws against our natural born citizen rights. we've been successful at utilizing that through the system, through the judicial system, of having public servants held accountable for their oath of office when it comes to taking away rights that we have that cannot be governed, period. We have under Title 18 USC Section 242, deprivation of rights under the color of law. It is a crime for a person acting under color of any law to knowingly and willingly deprive a person of a right or privilege protected by the Constitution of the United States. We are here now in force in Livingston County to hold all public officials accountable to the oath of office when it comes to our rights. And we as people are trying to come to the community and to the board to work together to do what's best for the community. My small children go to Three Fires Elementary. And I apologize, I forgot to start with that. My address is 2015 here on Loop Drive in Howell, Michigan. I've been rejected from being able to bring my children into school without a mask. I've went to 5 different doctors who flat out told me they would not sign a waiver because of the implications that come with that from the community and their fear of their business being taken down. So there is no law that can be mandated that you can test children before and after a game, that you can force the mask inside of schools. It's continued on long enough. I stand with everybody today, even those that oppose not granting the declaration of emergency, because we as individuals have that right, but it's no longer an individual right or opinion. It has to be based off science and facts. And if it's not, then all public servants will be held accountable to the oath of office. And I appreciate everybody's time.
Thank you for joining us.
Thank you for having me.
Bill Bolin.
Yes, commissioners, thank you for your service to our county. And I would like to voice that I am opposed to the extension of the emergency order. I live at 1516 South Old US 23, Brighton, Michigan. And I'm the pastor of a church, and I represent at least 1,000 people that I can pretty much guarantee would stand in the same opposition. We want to see the emergency mandates, the emergency extensions. We want to see them come to an end. Right now, the CDC, I'm sure you're aware, has just changed the standard for social distancing among schools. They're recommending 3 feet rather than 6 feet, which brings us back to almost the same standard that we had before social distancing went in effect over COVID. That's basically, you stay in your space, I'll stay in mine, a 3 feet distance. And right now we are coming close to what we call herd immunity, as I'm sure you're also aware. It's scheduled to hit somewhere between May and July, which is why President Biden had made his statement that he was hoping that this virus would be licked by July 4th and everyone would be able to go back to picnics. The people that I represent, we find it reprehensible that here in Michigan, a business owner has been locked up with no opportunity for bail or release for running a business, a restaurant, with people practicing safe measures like staying home if they're sick. Whereas we've opened up our southern border and we're allowing a massive amount of people to cross the border, with our own government saying in excess of 50% of those people who are crossing into America illegally are COVID infected. And right now there's been a requisition for planes to fly those illegals to northern states like Michigan in order for them to settle and to disseminate into the people. It's time to stop these emergency orders. Let us see you face to face when you're having meetings. We can properly distance in whatever way you want us to, but it is time to bring these emergency orders to an end and help to guide us back to a place of resuming normal life. That's all. Thank you very much for listening to me.
Thank you for joining us this evening.
Gianni Kazan.
Hi, I'm Dr. Gianni Kazan. I live at 1700 Deanna Drive in Howell Township. Thank you for allowing me to speak. First, I would like to say that no, I am also against extending really any emergency order regarding this entire deal. Governor DeSantis held a public health roundtable discussion about 4 days ago and invited experts. He had Dr. Atlas was there, then Dr. Gupta from the UK, and then Dr. Botticelli, and another person, I forgot to write the name down, from Sweden. And they looked, I encourage you to go look at that. It's on YouTube 4 days ago. And they had questions like, are lockdowns effective? And they looked at the data and summarized it in that, saying lockdowns, contact tracing, masks. We did that through the whole fall, the winter, and it did nothing to help reduce and avoid the surge in the wintertime. We've already done it. We've proven this doesn't work. So Dr. Atlas said, quote, I think the lockdowns are the single biggest public health mistake in history, close quote, and that fear is another contagion. And that's what I'm seeing, fear. People are making decisions based on fear rather than using their brain to look at the actual data and make decisions that are logical. It makes absolutely no sense when you've already done multiple steps of masks and lockdowns. You see the numbers went up and they came down. They didn't come down because of the mask. They went up. Things got worse. And the lady that was saying that, you know, continue this so you can have safe meetings, it's just an emergency order. But emergency orders, they affect everything. They affect everything. So if, for example, what was good about a lockdown was one of the questions. 40% didn't get their chemotherapy. Up to 78% of the cancers didn't get diagnosed. People don't go for medical care in emergencies because they're afraid of what they're encountering there. I am afraid to take my own children to our own Livingston County emergency rooms because they're not going to allow me to go in with my 20-year-old. I'm going to try to manage everything at home at my detriment as a parent. Even though I'm a doctor, I don't do all that. I'm an obstetrician, but I will take a risk because the cure of this emergency order is worse than the actual disease of a virus, of a virus that has such great chance you're going to survive it. So what?
You have 15 seconds.
Okay, so I encourage you guys to go, and as far as schools, 1.8 million kids in Sweden went to school between ages 1 and 15, daycare and school, 0 deaths. Open them up. They had no masks, no restrictions, open them up. We need Livingston County opened up, please. No more emergencies.
Thank you very much.
There are no other hands raised on the system. Is there anyone else in the public who wishes to speak that cannot find the raise your hand function? If you just wave your hand, I would be happy to. Okay, Sabrina, you are up next.
Hi, Sabrina Murtis here, 5245 Kennecott Trail, Brighton, Michigan. I'm also another one that wasn't really planning on speaking tonight, but I am going to agree with 99.9% of the people that had previously spoken. We need to end this. It's a joke. The numbers aren't there. And it's unfortunate that if you guys do continue on with that, you're going to lose a lot of respect of good citizens. So I'm just another one that's on here encouraging you guys to open up the county because the numbers are not there. So thank you. Thanks for everything you guys are doing. And we hope that you vote to not extend it. Thanks.
Thank you.
Cindy Holland.
Hi, my name is Cindy Holland. I live in Howell, Michigan, and I appreciate the opportunity to speak on this issue today. I'd like to say that we can no longer continue down this path of destruction. Our children are suffering tremendously. The damage from unintended consequences far outweigh the benefits of continuing Zoom meetings. We need to take proper actions to correct the damage and put our lives back on course. I urge you to vote no on the extended state of emergency because there is no data that shows that we are in a state of emergency. Thank you so much.
Thank you. I see Mr. Nieper has his hand up, but he spoke earlier at Call the Public. So I'd say, Mr. Nieper, if you want to speak again, we have Call the Public again at the end of the meeting. Cindy, is there anybody else?
Yes, there is one more. Joe and Kathy, you are up next. Are you okay? There you
I
go.
just unmuted myself. Kathy Carney, 6294 Kenyon Drive, Brighton, Michigan. Today, Livingston County has made the national news because of the more contagious variant of the coronavirus has been identified in Livingston County. COVID-19 variant known as B117, which experts say is 50% more transmittable than the dominant virus strain in the United States now. So it gives me pause to think we want to open up as much as we do. And I believe Zoom meetings are good for the general public. Thank you.
Thank you for joining us.
Are there any others that would like to speak? Commissioner Nakagiri, does not look like there are any others with their hands raised that have not already spoke.
All right, so I'm going to go ahead and close the Call the Public and thank everybody who took time out of their busy schedules to, whether you're for the resolution or against it. We do, I can speak on behalf of the board, appreciate the feedback. Item number 7 is approval of minutes. We have 2 sets of minutes, one dated March 8th, 2021, and then there's a correction on, so the minutes dated not March 22nd, but March 17th. So we have minutes dated March 8th and March 17th. I'm looking for a motion to approve the minutes.
So move, Zajac.
Support Gross.
Motion by Zajac, supported by Gross. Any corrections or additions to the minutes? Hearing none, roll call, please.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
and Commissioner Drick.
Yes.
Motion carries.
Thank you. Item 8, tabled items from previous meetings. There are no tabled items, so we'll move on to item 9 of the agenda, and that is approval of tonight's agenda. Is there a motion to approve the agenda?
Motion to approve, Griffith.
Motion by Griffith, support by Helserman. Any discussion? Hearing none, roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
and Commissioner Zajac.
Yes.
Motion carries.
Item 10 on the agenda are reports. Tonight we have 2 reports, plus after the 2 reports will be an opportunity for commissioners if they have a report to provide it. But we'll start the report section with a report from SEMCOG. Ann O'Leary, the Executive Director of SEMCOG.
Hi, thank you, everybody. I'm going to quickly share my screen with you. If you can enable me to share my screen, that would be great. Okay, there we go.
You should be all set.
Thank you. Okay. All right. I want to thank you for your time tonight. My name is Amy O'Leary. I'm the Executive Director of SEMCOG, and also here tonight is Amy Malmer. She's the Membership Manager from SEMCOG. While this is a little different than our normal visits to you and presentations, we thank you for the opportunity to come here tonight and come before you. We wanted to give a little update about some of our work and a little bit about SEMCOG. So first, our work is focused on meeting a vision where all the people benefit from a connected, thriving region that includes small towns, dynamic urban centers, active waterfronts, diverse neighborhoods, premier educational institutions, and an abundance of agricultural, recreation, and natural areas. As you may know, we serve 7 counties, and it includes counties, cities, villages, townships, intermediate school districts, and community colleges. Our membership is at an all-time high of 175 members. Commissioners Zajac and Drick are your delegates to both the General Assembly and the Executive Committee. Kathleen Klein-Hudson and William Anderson are your alternates. In addition, Commissioner Zajac was just elected to our Regional Review Committee last week that helps make decisions on grant opportunities at SEMCOG. So we want to thank them and all of you for your participation. Membership at SEMCOG is organizational, so while they are our active members, please feel free to attend our workshops or contact our staff for any data or information that you might need. We primarily work on regional issues in the areas of transportation, environment, community economic development, and education. So really briefly, I want to go over a couple of these. We're responsible for the region's long-range transportation plan, which really charts the course for transportation planning around Southeast Michigan. And it's what makes the region eligible for $1 billion in transportation funding annually. The long-range plan is implemented through a 5-year list of projects called the Transportation and Improvement Program, or TIP. And you can see here, the chart shows the TIP projects in Livingston County in 2021 by project type on the left. So it was just over $18 million. The map shows the transportation projects that are currently in our TIP for Livingston County over those 5 years. We also work a lot on transportation and traffic safety. It's a major priority. And to assist local efforts, our team analyzes and shares crash data in a very usable and easy to understand formats. And for example, the crash location map on your left includes all the crashes in the region over the last 5 years by crash severity, but you also can break it out by key factors such as alcohol, young drivers, if a pedestrian or a bicyclist was involved. We also work in the areas of trails, and regional trails are a major asset in our region. They do help attract and retain residents, as well as provide a healthy outlet to connect with nature. So over the last 3 years, SEMCOG has provided Livingston County and the communities with over $1.8 million to help both plan and develop trails and non-motorized connections. Additionally, we've mapped over 1,000 miles of Southeast Michigan's major water and land trails through what's 360-degree imagery. It's kind of like Google Streets, but being able to look at your trails and in your water trails. This example here is the Lakelands Trails State Park on your left. In the areas of environment, a major part of our work is planning for and enhancing our natural areas and our parks. SEMCOG's Park Finder application provides information on recreational opportunities for over 2,600 parks in our region. So for any park, you can click on it and find the list of amenities and information like size and ownership. And what's displayed on this screen is Settlers Park in Heartland Township. A very recent initiative that we're undergoing right now is collecting water infrastructure asset management. It's in partnership with our local communities and gathering underground information such as drinking water, sanitary sewer systems, and stormwater collection systems. So far, we've collected, you can see along the bottom, 12,000 miles of water, 10,000 miles of sanitary, and 8,000 miles of stormwater information. We've very happy to report that you all at Livingston County are a big partner with the Drain Commissioner and what you're able to provide us. And really the goal of that program is, one, to really look at the age and the needs of all of those systems, but also for coordinated infrastructure planning so that when you're doing a road project, you know what's going on with the water and the sewers underneath, for example. Just last week, our General Assembly adopted our region's economic development strategy, and now we're looking forward to moving on with implementing the policies and actions from this plan. One example is our Shop Local program, and it's a campaign where we partnered with local communities to highlight and promote small businesses and support them as they have supported us. So shown here is promotional material that we've done for Shop Local Brighton. We're also implementing the economic development strategy by working more on broadband. And the emphasis of this strategy is the need for addressing the region's broadband accessibility gaps. So on the screen, you're going to be seeing our broadband availability and usage tool. And at SEMCOG, we have a lot of maps and data that hopefully helps you at the county and at the local level make decisions, whether it's on broadband or demographic information. We have community profiles, that kind of information, the traffic information that we provided earlier, hopefully can help you as you make your decisions locally. So this tool was developed to help answer questions like, is there service available? If there isn't, how large of an area is there not service for? Or what are some of the reasons that people might not be using it even if there is service available? This helps us really focus, and we are forming committees to be able to look at what are the opportunities to expand broadband usage across our region. We also work in the area of education. We have members that are education communities, and it's very important to us when we look at especially the talent and the future skills work in Southeast Michigan. We've identified a number of recommendations related to building support for multiple career pathways and being supportive of learning and teaching what those pathways are. So that's really just a quick snippet of the types of things that we do at SEMCOG. But I just wanted to share with you how there's opportunities to engage with us. You should all receive our bi-weekly newsletter digitally called Regional Update. And that's really a quick way to stay informed on what we're working on at SEMCOG, whether it's activities, upcoming training, ideas for grants, or legislative issues. You might also consider getting more involved. We work a lot in task forces on specific topics. And as I mentioned, we're getting more involved in broadband, also looking at forming an infrastructure task force, and also one on traffic safety. So let myself or Amy Mulmer know if those are any of the topics that you or maybe your staff at the county might be interested in participating in. I have to say that your staff at the county is always very active in our regional planning efforts, and we really appreciate all the work they've given and support they've given us over the years. We also continue to engage in a lot of educational programs. So you saw the Shop Small, but we also work in on a program called Walk, Bike, Drive Safe Southeast Michigan, which is our safety program, as well as One Water, and educating the public about opportunities to keep our water clean. I'd encourage you to take advantage of the resources we provide. I know we sent something out recently offering bike lights and other materials for the Walk, Drive Safe program, for example. Legislatively, we're engaged in legislative activities. We share our policy positions, which we just came out with the new policy positions in the last few months. We share those both in Washington and Lansing, and we encourage you to use us as a resource on these issues. Most of our items for legislative watches might come up as a separate email directly to you on a legislative action alert, or look in Regional Update. And then we've really increased the amount of trainings that we put on, and right now a lot of them are over Zoom, and encourage you, here's a couple that are coming up. One is one of our new tools that was developed as part of the economic development strategy, and another one is on using surveys to enhance your community. All of our webinars that we've ever done are now on an on-demand, so you can go back and watch them at your own convenience as well. And finally, I want to ask you about connecting with us, whether it's on our social media We also have staff available to answer questions or fill any kind of requests that you might have. And that's it. I just want to thank you so much for your membership. Livingston County is an important part of our region. We really love working with all of you. And I thank you for the opportunity to share a few things that we have going on in Southeast Michigan.
Thank you very much, Amy. I apologize. I think I called you Ann.
Oh, that's okay. It's all right. I appreciate the time tonight, really.
Next on the agenda is COVID-19 vaccination update from our Director and Public Health Officer, Diane McCormick.
Good evening. Had to find the unmute. I'm sorry. 2 weeks ago when I presented to the board, the Livingston County senior 65 and above vaccination coverage rate was about 16% lower than the state average. And I am happy to say that we have made some significant strides with that. Now we are only at 9.3% lower. So at least it's trending in the right direction. We're having a lot of efforts out there with other pharmacy partners, IHA, and some of the healthcare systems that's assisting with vaccinating our seniors. And last week, Myers did it was about 1,100 dose vaccination clinic last Tuesday. And the report I got back from the Myers rep that it went very successful, which I'm really encouraged to hear. So hopefully they'll be holding other events at the Livingston Myers since the event was so successful. So more information to come on that. Vaccine allotment for first dose shipment that we got this week was about 2,200. Plus we received 1,500 second dose allotment. And I just need to comment because we're seeing some problematic issues coming up with folks that are getting their vaccine outside of the county, wanting to get their second dose here in Livingston County. And the problematic side of things is when we get 2,200 doses, first doses in 28 days, we're going to get another 2,200 second doses. So it's we receive the same amount of second doses that we do on first doses for those folks. I don't know what the right answer is. We're telling people that wherever you get your first dose, you need to get your second dose. Unless they were a snowbird and they got it down in Florida, then we'll try and work things out. It's very difficult to turn people away because they're county residents. And they are having in certain situations some issues in getting their second dose if that appointment conflicts with when they may not be able to get there. So more information to come on that, and need to have some more dialogue at the state so we can figure out how to better accommodate our county residents. But other than that, we've got to tell them they got to go back to where they got their first dose. So hopefully I'll be able to share some additional news on that in future reports. We should also be finding out in the next week or two the amount of Johnson & Johnson vaccine that we'll be receiving. There was a pause with the Johnson & Johnson vaccine that we were receiving because the company was able to get all the doses out nationwide. So they had to ramp up so they can get more doses manufactured. The one thing that we should know is probably next week or the week after, hopefully receiving some regular shipments of Johnson & Johnson as well. So that'll be another opportunity for vaccination. That's a one and done shot. Last week, we began vaccinating at Chilson Hills Church. It has fantastic internal space. It's a perfect setup, but parking is a challenge. It is a real challenge, and I see I've got a little bit of a sun on my face. It is a challenge. We do need parking lot volunteers. We may need to think about longer days to vaccinate any volume over 1,200 people a day because of the challenges with the continual inflow of people coming in and people leaving. But other than that, internally, it's really a good site, good location as well. We've been fortunate to have Michigan National Guard assisting us, but lately our request for support has not been filled or only partially filled. So we may need to look at other contract nursing companies to assure we have enough vaccinators. You know, we're adding nurses, we're adding physician volunteers almost on a daily basis. And more recently, we're starting our first responder firefighters are also joining, but many work other jobs. And the one thing that we don't want to be is left shorthanded with our vaccinators. We are onboarding a lot of non-vaccinator volunteers. A lot of county employees are stepping forward to volunteer, which I'm so happy to see. So we are able to fill the non-vaccinator spots, but I think as we look at it in the future, we're going to have to also look at other sources, and that might be through other companies that will provide or nurses at a paid rate if we need to in the future. Right now, we're okay, but I don't want to be left shorthanded. Last Saturday clinic, this is a little stubbed our toe a little bit. Last Saturday at Chilson Hills, we targeted 60 and above. And of concern was, you know, for the first few days when we had the vaccine interest form on our county website back in December, we didn't ask for ages. And we had probably 3,000 people that signed up on the vaccine interest form. So in an attempt to find the 60 and above age group, we sent out the link for a vaccination opportunity to 3,000 people with big, bold red print that this clinic is for 60 and over. And if you schedule an appointment and do not meet this criteria, your appointment will be canceled. And I got to tell you, we were really successful in finding our 60 plus, and some of them even in their 80s and 90s that had never had an opportunity to schedule an appointment because we didn't have their age. So they were so happy and grateful to get that opportunity. But we had many younger people that were very unhappy who scheduled an appointment, and we had to send them a cancellation. Some showed up anyway, and they were turned away. We probably had 50 that happened to. That was very unfortunate. I look at the positive side. We were able to find the ones that we were seeking out, and unfortunately, we had to turn some people away. This is a lesson learned, and it's not going to happen again. I'm surprised no one showed up tonight. But you know, we were. I look at it as my cup is half full. We did find those seniors that we were seeking. Sunday, we held a drive-through event at the Livingston County Health Department for our homebound seniors and their caretakers with the assistance of Livingston County Catholic Charities. They did all the scheduling for us. We vaccinated 225 people. And we have about 90 people left on our homebound list that weren't able to take the opportunity of the drive-through. So we were able to get that number of sending our nurse volunteers out to the homes down considerably to now we've got about 90 left on the list. So that was also a very successful event that was held on Sunday at the health department. Beginning this week, we're sending out opportunities for appointments for those that are 50 and above, but we're still looking at priority of those that are more of the older 60 and above. The state right now, the priority to get a vaccine is 50 and above, so we are going to open up some of those slots as well. We have 2 first dose 1,100 appointment clinics and 2 second dose clinics scheduled this week. So we'll have a busy week. And I wanted to comment that I heard today that Walgreens is now being added to the federal pharmacy CDC program and will be beginning to receive vaccine directly from the federal government. So they're joining Kroger's, Myers, and Rite Aid. So at least there's more opportunities that's going to be become available out there to our residents. And I wanted to just talk very briefly about FEMA also setting up the vaccination center at Ford Field. They're operating 7 days a week, 6,000 doses a day. And so there's also an opportunity. I'm hearing from many residents actually that have already received a text. They're using Myers, their scheduling system through Myers to text and schedule the vaccination appointments. And we're starting to hear from our residents that they have an appointment already scheduled down at the Ford Field. For those that don't have a link or know how to get an appointment, we do have that link directly on the Livingston County Health Department website to assist those folks in finding the link if they can't find it directly. And with that, that is it. And I'm happy to answer any questions.
Mr. Chair, I have a couple of questions, if I may.
Yes, Commissioner Lawrence, go ahead.
Thank you. Hi, Diane. Thank you for being here. A couple of questions. Do you receive the numbers from the people that have been vaccinated, like at Meijer or Kroger? Do you receive those numbers?
I do from Myers. I don't from the other federal pharmacy program stores.
So for me to ask you, can you tell me what percentage of residents in Livingston County have been vaccinated? Your numbers aren't accurate?
No, the data dashboard that the state has, all of Rite Aid, Kroger's, Myers, they have to enter into the MICR system every time they give a dose of the vaccine, and that number goes towards where their address is at.
Okay.
So there is accurate accountability for how many people in Livingston County are vaccinated based on the state data dashboard.
Do you have that number? I can look it up.
I did. There's several thousand.
I guess I was looking for a percentage, like is 50% of our residents, have they been vaccinated?
Senior population, we have 65 and above, 54.41%. The state average for 65 and above is 63.7%. And Livingston County, also includes the senior population, 23.94%. versus the state is at 28.5%. And I will say that's the first dose initiation. That doesn't mean completed. It's the first dose initiation.
Okay.
Does that help?
Yes, it does. I appreciate that. That's all I have, Mr. Chair. Thank you.
Thank you. Other questions or comments from commissioners?
Mr. Chair, I have a couple of questions.
Commissioner Zajac.
Thank you. I want to reiterate what Commissioner Lawrence said. Thanks, Diane, for your team. For my colleagues, I texted Diane on Sunday and I said, please don't answer if you're enjoying a much deserved day off. And I got a text back with a picture of a vaccine clinic. So that goes to show the hard work that she and her team are doing. And I would just say, Diane, to the extent that there's anything, your team, you need, please bring it to us as soon as possible and we'll do what we can to help. One question on the volunteers situation, actually a couple of questions. You mentioned that we may run short of vaccinators. How many are needed and in a given clinic, and what are the qualifications that you're looking for?
Depends on the size of the clinic. If we're running 2 shifts and we've got, let's say 13 or 15 vaccinators, we try not to work the vaccinators 8-hour days. We tried to do it in 2 different shifts, though some of our vaccinators can vaccinate for 8 hours. So if you're looking at 13 vaccinators, 2 shifts, that's 26 vaccinators. And the qualifications, nurses, doctors, we're even looking at expanding that and exploring dentists, veterinarians, you know, so we can open up that pool. But you have to remember, a lot of people work during the day, so there's some of those challenges too. The Michigan National Guard has really stood up and assisted us in the vaccination efforts, and unfortunately they're spread thin, and many of our requests to get the Michigan National Guard right now is going unfilled.
Yeah, that's a good segue to my next questions. On the National Guard, why do you have any idea why they're being unfilled? I know at the beginning they were very gung-ho about supporting, and I'm just curious about what has changed or what has happened to cause
Well, I think
this non-filled.
That's a good question. But as vaccinating gets more readily available, there's larger clinics. Hospitals are also requesting that are doing large vaccination clinics. So they've expanded it. So hospitals are using the Ming. The Ming is also vaccinating into prisons. So you only have so many. And health departments are going from 500 dose clinics to 1,500 dose clinics, you know, requiring more of that asset.
Okay, so there's not been conversation about why, other than just the speculation about because there's more need.
Yes.
Okay. I mean, would it help to ask them why? And I mean, I suppose going through our state representatives, if needed, to escalate the issue might be worthwhile. I'm speculating as well. I don't know. I'm just asking for your input on that.
Well, I really don't know how many Michigan National Guardsmen that there are that are qualified to vaccinate. Some of them aren't qualified to vaccinate, but they're assisting in other ways at our vaccination clinics. So I'm not sure if it's we don't have enough guardsmen.
Okay. All right. Thank you. I don't have any more questions, Mr. Chair. Thank you, Diane.
Mr. Chair?
Commissioner Plank, go ahead.
Hi, Diane. I was listening to what you were saying about the volunteers, and one of the things that came to mind is, are we using student nurses to help out with that? Just curious if that's a path that you guys have also taken.
Yes, we are using student nurses as well. Student nurses also have to have a certain level of supervision. So it's a double-edged sword a little bit.
Right. Okay. Thank you. That's all I have. Thank you for your good work.
Thank you.
Any other comments or questions from commissioners?
Mr. Chair, I have some questions if I could.
Commissioner Helserman, go ahead.
Good evening, Diane. I was there, went by that your site on Sunday just as you were finishing up and the last car was driving away. So thank you for your work there. Do you have an idea of what is the percentage of vaccinations needed to say that we are close to herd immunity? How is herd immunity defined?
You know, that's a good question. You know, as I listen to the experts out there at the CDC, at the state, the physicians, and those, you know, they're at 70% is a number that I hear quite often to really to be you know, so we're it's an exception versus the norm when we start seeing cases out there. You know, 70% seems low to me. I want to see, 90%. But, recognizing that right now the vaccine that's out there, Pfizer is 16 and above and Moderna is 18 and above. So there's always going to be that the younger population that right now the vaccine is not available to.
Right, but we would assume that we're talking about that percentage of the population that would be likely to catch it. But I just wanted to have some information on that. Secondly, in late February and early part of March, there was a significant rise in cases. Could you address that a little? And what there was quite a cold spell there, and the October, November spike was also preceded by the weather becoming much colder. Could you just comment on the increase that we saw in I guess it kind of started middle, maybe late January, early February, and we're kind of still maybe on the tail end of that now?
Well, looking at January, there was a spike right after the New Year's Eve holiday. So you expand that out another 14 to 21 days. So we did see a slight increase, but we've been trending down until recently. And I think that a lot of that has to do with we're seeing the B117 variant out there in Michigan and in the community, and it is 50% more transmissible. We're seeing some athletic events, younger kids that are testing positive. So I think that, we're going to see very shortly here in the state of Michigan where the V117, that's the UK variant, is really going to be from what I'm hearing, the predominant strain out there. And that's why it's so important that we get, the vaccination ramped up sooner so we can at least get those vulnerable populations vaccinated before the variant takes hold statewide. Michigan is like in the top 4 states in the United States seeing the B117 variant.
And I believe this would be my last question. Is there any way, because our only metric is cases, is there any way to, at least in Livingston County with your numbers, to easily stratify the numbers in the seriousness of cases? Because the cases are up, deaths don't always go with cases. The number of deaths maybe is a trailer, and sometimes it's going down when cases are going up. Is there, do you have any available information as to percentages of serious cases as to almost no symptoms? And then do you have any way of quantifying the seriousness of the cases that we see?
But we currently, and it's trending up slightly, have 6 hospitalizations. And most of the hospitalizations tend to be in your older 60 and above age group. And that's what we're seeing also with the 6 cases that are hospitalized. Right now, we're seeing most of the cases, we're averaging right around 49 cases a day, are in the 20 to 40 age group. And while they are sick, they're able to more readily get through, less compromised. being the illness itself. So it's difficult. We know age groups, and we know how many hospitalizations, and we've had about 4 deaths in the last 3 or 4 weeks. And the deaths are primarily in the 80 and 90 age group. And I don't know if that answers your question.
Yeah, I just wondered if there, because there are some fear words that are used in our society, and I just want people to have a realistic number. When we say cases, that's the only number that we get, and we have no idea of how serious, the number of hospitalization. You really have to look for that, or the number of deaths is quite readily available. But it just would be nice, I think, if we didn't have people that only used words that struck fear in people's hearts. Maybe some words that struck some reality and a balance. And so I just wondered if that was available easily. So you could say, of the 43 cases a day, 5 of them are very serious, 10 of them, are pretty serious, there are 15 cases that are symptom-free, that sort of thing. And, it just would be, I think the general public would feel better if we had a realistic picture, because as we've heard tonight, there's a lot of us that are, we hope that the word normal is still in our vocabulary pretty quick here. So, but thank you very much for your time. And again, thank you for all your tireless work. We do really appreciate it, all that you do for us. Thank you. Thank you, Mr. Chair.
Any other questions or comments from commissioners?
Mr. Chair.
Commissioner Griffin, go ahead.
Diane, thank you for your hard work. I know it's continued 24/7, and nobody's been in your footsteps in the past. And every day is a challenge for you. So we all appreciate the work and everybody that's working with you. Based on the information you gave us tonight and how many vaccinations have taken place and kind of the road to vaccinations, I know this is a tough question, but can you kind of give us a basic idea on where you kind of see things at the end of May? So in other words, 60 days, what's the percentage do you think, based on the rate of the vaccinations we've been getting, would you think will be, what level do you think we'll be at?
That's a good question. When I hear the state this week saying that we're going to get about the same amount of vaccine into the state, to the state health department for distribution that we received last week, I get concerned because that means I'm going to get the same amount. It's not increasing. The encouraging part of it is if regionally we start seeing more vaccination stations like we're seeing at in Detroit, where it's put out regionally based upon the emergency preparedness regions. I think that's really going to be very impactful. People don't necessarily need to get their vaccine in Howell. People are willing to travel to Lansing, to travel outside of our borders. And there's no reason that, we stand up these vaccination clinics county by county where there can't be some more collaboration. So your question is, by the end of May, I think it will be a lot better than what it is now. and there might be more vaccine with Johnson & Johnson wrapping up. And it's really hard, though it's really hard to tell what that number is going to be. It's going to be higher than what it is now, but about what degree it's based on the number of vaccines and the number of people that want to get vaccinated. That's also going to be a challenge.
Okay. Thank you. Thanks, Diane. And again, thank you very much for your efforts, and always being available to us to answer questions too has been a huge help.
Any other questions or comments from commissioners? Commissioner Gross.
Mr. Chairman, thank you. Diane, I want to echo what my colleagues have said about the work that you and your staff have been doing. It's incredible, and I applaud you. I guess the question I have is, do you have any way of estimating when all of our seniors over 65 will be vaccinated? I mean, we keep hearing that the pools are being opened to 50 plus and 16 plus and 18 plus and so on and so forth. I'm more concerned about those folks that are 65 and over, and how many of those are left, and when will we be able to have them 100% vaccinated if they want it?
So we're at, as of today, 54.41. So percent 65 and over that's had a vaccine. So, and that's of 30, I think 34,300 is the number that we're using as that population. So we continue to prioritize. We've got the phone bank going. We have about 250 people that is left for us to call that we are trying to knock that out this week, that do not have an email. So we should get through our calls all the rest by the end of this week and get a hold of those folks that if they want to get a vaccine, we have an appointment for them. And just so hopefully in the next maybe 2 or 3 weeks, we'll see that number well into the 60%. And statewide, we've got some counties that are in the 70% vaccination coverage for the 65 and over, and some of them are struggling. They've got the vaccine to get above 50%.
Okay. I'm hopeful that we'll be able to reach as many of those folks as we can. It tears my heart out to listen to people call in and for whatever reason they're not able to either get an appointment, or appointment is 2 months out and they've got health issues. And for some of these people, I still feel it's a matter of life and death. And I just pray every day that we can take care of those folks that need it the most.
And I agree. And just, I'll get off my soapbox. I'm part of the Leadership Livingston Council on Aging, as you are too, Jay. Yeah. And our assets are out there as our senior centers. And if we can get the senior centers to do some outreach to assist us with finding the vulnerable population that may not know how to get an appointment, that's our next step.
Okay. Let me know if I can help with that.
Will do.
Thank you. That's all I have. Thank you, Mr. Chairman.
There are questions or comments from commissioners? Seeing and hearing none, I've got a couple of items. Diane, we've chatted before. The commission has taken the issue of social vulnerability index and how that impacts unfavorably the Livingston County in terms of getting a vaccine allocation. When this, to your knowledge, when the state of Michigan, set forth the rules and how they're going to allocate vaccines and using, and that they were going to use SVI. Did they conduct hearings? Did you get notified of any hearings or public input?
Not that I'm aware of. They presented it. I believe I gave you the slide presentation that they rolled out concept.
Okay, all right. Yeah, I saw. Yeah, I appreciate you sending me that presentation. Second question: is our base allocation still 1,400 doses a week? Is that still in effect for Livingston County?
I'm going to say no, because we've been receiving more than that on a weekly basis for the past 3 or 4 weeks. We were receiving 1,600 and then 1,800 and 20, so we're above 2,000 now.
Okay. When the base allocation changes, would you get notification, or I mean, that, hey, the state of Michigan formally change, up the base allocation, or is it the case that our base is 14 and they're just giving us extra? Do you know one way or another?
I can ask that question. I'm assuming that they've gone away from the base allocation because all of the local health departments have been receiving above, unless the CDC backs off on what the state is receiving vaccine wise. I'm assuming that our allocation is 2,000.
Okay, all right. Early on in the vaccination process, the state of Michigan published a document that had every county listed on it and what was the quantity of their target population. At that time, target population included, and target population, just to define that term, are people that are eligible for the vaccine. It included, back a number of weeks ago, 65 and older. It included, frontline essential workers and a couple other categories. I know you and I had chatted recently about, getting an updated list of target population, so we have an understanding of what the quantity of people is in the new target population. It's obviously now, instead of 65 and older, it's 50 and older. Is that list published? Have you seen it?
It's not published, and I did send an email up to the state to see if they were going to update that, because it showed frontline workers, school and adult or school and childcare staff, and it provided us a kind of a baseline. And I've not received an update, but April 5th, it's opened up to 16 and above. So whatever our population is, 16 and above, is what the number of the population is in Libya.
Okay. All right. Well, I'll dig up the numbers, using census statistics. I am curious if, even with SVI, I had some data analysis showing we were still getting short, and I'm wondering if we are, how we're doing with respect to other counties. You really I can't make that assessment without an understanding of, what is that target population county by county, but I can certainly estimate it from census figures. That's all I had. Other than saying thank you very much, Diane. You're doing yeoman's work. It's greatly appreciated, and I echo the sentiment of my colleagues on the board. And any final questions or comments for Diane? Hearing none, we'll close out the COVID report and ask if any commissioners have any reports that they want to share with their colleagues.
Mr. Chair, a brief report from me, please.
Commissioner Zajac.
Thank you. The Amy stole my thunder on the SEMCOG topic, so only thing to add to that is I've enjoyed working with Commissioner Drick and SEMCOG so far. And so looking forward to the opportunity to bring more resources to the county to invest in some of our priority items through that group. I also sit on the MAC HHS committee, the Michigan Association of Commissioners, Health and Human Services Committee. And there was a meeting today that I wanted just to discuss a couple of things. One is there was a call for agenda items. So to the extent any of my colleagues have thoughts on what initiatives MAC, you would like to see MAC push with the state MDHHS or any other sorts of calls for regulations or rollback of regulations, whatever the case might be, that invitation was opened to us today. It's always open, but it was a reminder to us today. And the other thing that I wanted to bring up is there was discussion about the opening up of the state economy. It sounds as though through the discussions that MAC is having with MDHHS that there are topics that the new director is willing to explore that are not as restrictive as we have seen in the past. My understanding, though, is there are folks that want to push for vaccine-based opportunities, which we just had a good 30-minute discussion about how we would be on the short end of that stick. And there's very likely to be other factor-based, I should say, whatever those factors might be, reopening proposals. So I know that as my position on that committee, I'll be fighting against anything that sets the county back in its position based on any sort of allocation based reopening scheme. And I, as always, would welcome my colleagues' input on counter proposals as those opportunities arise. So that's all I have for my report. Thank you, Mr. Chair.
Other reports from commissioners? Hearing none, I'm going to give a quick report. It's really a reply to Commissioner Zajac. You know, there are other states, Indiana for one, as a neighboring state that where the state leaders, the governor has allocated, not the right word, but has left it up to counties to make the decision on, you know, the level of emergency. And I would strongly advocate for that type of setup, you know, through MAC and see if we can get some progress in that regard. So thank you. We'll close out reports and move to item 11 on the agenda. It's approval of the consent agenda items. There's only one item on the consent agenda. Resolution 2021-03-037. It's a resolution authorizing an additional contribution to MERS in fiscal year 2021. Is there a motion to approve the consent agenda?
Motion to approve. Griffith.
Support, Gross.
Motion by Griffith, support by Gross. Any comments or questions? Hearing none, roll call, please.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri,
Yes.
Commissioner Helserman,
Yes.
Commissioner Dreck,
Yes.
and Commissioner Zajac.
Yes.
Motion carries.
Item 12 on the agenda are resolutions for consideration. We have 3 resolutions tonight for consideration. The first one, resolution 2021-03-038 is a resolution approving appointments to Livingston County boards and committees. Is there a motion?
So move, Helserman.
Support, Griffith.
Motion by Helserman, support by Griffith. Any discussion? There's a number of appointments. Hearing none, roll call, please.
Commissioner Helserman,
Yes.
Commissioner Dreck,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader, Yes. And Commissioner Nakagiri.
Yes.
Motion carries.
Thank you. Resolution 2021-03-039. It's a resolution approving an appointment to the Livingston County Tax Allocation Board. Is there a motion?
So move, Gross.
Support Helserman.
Motion by Gross, support by Helserman. Any discussion?
Mr. Chair, how many people applied for that position?
I believe it was 4 or 5. I'm not 100% sure.
There were 5 that applied for it.
Okay. Thank you.
Yes.
I like to see people wanting to be involved. Thank you.
Yes. Yeah, I think we've on recent we increased our effort to, in terms of recruiting, making, the public aware of what's, openings there are. And I think it showed in the tax allocation board and there's other ones that we're getting far more applicants than perhaps we have in the past. So other questions regarding the tax allocation board appointment?
Mr. Chair, I have a quick comment.
Yes, go ahead, Commissioner Zajac.
Thank you. Commissioner Lawrence opened my Pandora's box here, and I planned to not bring up a comment until our next Personnel Committee meeting, but I do recognize the progress that's been made on both advertising, if you will, the appointments, increasing the opportunity for good candidates. This is the second vote on this position that I will be making, once in personnel, once here in full board meeting. And unfortunately, or fortunately, I should say, we had good discussion in personnel, which outlined that this candidate was the only one that really completed the full application. It made it an easy vote. And there were some personal experiences with this individual that were very reassuring through that discussion. But the unfortunate part is the first time that had the opportunity to review the qualifications of any of the individuals was not until that personnel committee meeting, actually until the agenda came out for that personnel committee meeting a few days prior. So I would just ask that as we go forward, that we've been focusing on the outward approach of these committee appointments and being able to advertise them to the public. I would also ask that we include a focus internally so that the folks that will be voting, both in personnel as well as in the full board, have the opportunity, should they choose, to provide input on these positions. After all, they are our committees to be appointing, and I think that's an important part of the process. So thank you very much, Mr. Chair.
Thank you, Commissioner Zajac. Other questions or comments on the appointment to the tax allocation board? Hearing none, roll call, please.
Yes, Commissioner Gross.
Yes.
Commissioner Plank.
Yes.
Commissioner Lawrence.
Yes.
Commissioner Reeder.
Yes.
Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
Commissioner Dreck.
Yes.
Commissioner Zajac.
Yes.
And Commissioner Griffith.
Yes.
Motion carries.
Thank you. Next resolution is Resolution 2021-03-040. It's a resolution authorizing Livingston County to declare a local state of emergency. Is there a motion?
Move, Gross.
Support Griffith.
Motion by Commissioner Gross, support by Commissioner Griffith. Nathan or Therese, do you want to kind of give a little short?
Yeah. Sure. Thank you, Chairman Nakagiri. I'll give a little update. I wanted to follow up on a couple items that came up during last week's Public Safety Committee discussion about this. There was a question about the piece of state legislation that was going to potentially extend virtual meetings until the end of June. We received a call from our state representative last week, I think it was Wednesday morning, that bill is not going to get a hearing. And so the avenue that's in state law to continue virtual meetings is through the Open Meetings Act, which is what this resolution is based on. And I appreciate our state representative for keeping us in the loop on that. Another topic that was discussed last week was whether or not this resolution and this declaration would force local governments to meet virtually. We said last week that it does not. We confirmed that this week. Therese confirmed it. Don't want to speak for her, but I think you were forwarded the email from the State Homeland Security Division, which consulted with the State Attorney General's office, that this makes this an option for local governments, but it does not mandate or force them to meet virtually. If they're able to meet in person and not do it afoul of the state's health orders, then they have every opportunity to do that. And so those are a couple of updates that I wanted to share, some things that were part of last week's discussion. I think I'd rather open it up for questions. This is not tied to the state's health orders in any way, shape, or form. We're not extending the state's health orders at all. If that's what this was, this would not be in front of you tonight. This is simply an opportunity to continue meeting virtually for April and May. You also have the ability to end that sooner if the state amends their orders in a way that would open it up to meetings that would be permitted of our size. And so I think I'll leave it there. If Therese has anything to add, I think I'd be more interested in your questions.
If I could, I would like to add just a couple of things. We heard a lot of heartfelt perspectives and observations on how some of our people in this county and in the state were impacted over this past year. And it has been a heavy year. This, however, has nothing to do with extending the MDHHS orders. I want to make that very clear. This is strictly to be able to conduct government business virtually, period. That's it. Everything else that was mentioned, that has to do with the MDHHS order. This emergency declaration, when we put forth an emergency declaration per Act 390, what that's saying is we are in a situation that is unusual. And in that unusual situation, we'd like to take advantage of some resources that we would typically not be able to take advantage of. In this case, that resource happens to be able to meet on a virtual platform and stay within compliance of the legislation for the Open Meetings Act. The thing about that is, at the beginning of this meeting, which is a public meeting, and public meetings are very important, as we saw at the beginning, and we'll see again at the end of this meeting, that people should be able to give their opinions. With the virtual, you are able at this point, under the current orders, to host more people so that they can be heard. We had 68 people at the beginning of this meeting, 68 on this virtual platform, and everybody who wanted to speak at the beginning was able to. To meet in person would inhibit that in several ways. First of all, we wouldn't be able to put as many people in a room. Secondly, they'd have to wear a mask, which I'm sorry, but those masks are very difficult to communicate through. And I say that as somebody who can talk. So that is one thing. The other thing has to do with the other small jurisdictions within this county. There are 20. Each jurisdiction also has to conduct government business. This would open an umbrella for all of those jurisdictions and the smaller councils and other agencies that would have to comply with Open Meetings Act to be able to come under our umbrella if they wish. They don't have to. They can meet in person, abiding by the rules that are currently in place. However, they may. If we don't open that umbrella, they can, on their own, go ahead and do their own emergency declaration, and I will have to manage every single one. For instance, this evening, we've already had one local township who has done a declaration. It's been done properly. I notified the state, and it's been posted on the MySims as it's required to. So I will review and manage that and stay in touch with them for as long as they would like to have that in place through all of 2021. Just like with the county, they may rescind it at any time because it's their declaration. And if they wish to, at the end of where they've put a date on it, if they wish to extend it past, they may do that also. under the guidance of being able to do it in this manner through the year of 2021. And with that, that's all I have to say at this point. And unless there's questions, I'm happy to try to answer them. But the local emergency declaration is, there is a definition under Act 390, under which this entire process is complying, so that we can comply with the Open Meetings Act, which is more legislation.
Thank you, Ms. Garanti. And thank you, Administrator Byrd. Open it up for questions or comments from on this issue from commissioners. Commissioner Plank, go ahead.
Thank you, Mr. Chair. You know, I don't even know where to begin. All the comments that were made today in the call to public, I totally understand, and actually I'm more inclined to agree with a lot of the people and things that they said. The impact that locking down has on our kids and other things. And then I'm torn because, part of me feels that I want to protect people not coming in and catching COVID. I've been to chambers many times, and I would love to get back into chambers and meet with people. But I feel as if there were so many people on this call today, and I thought that even if we brought the commissioners back into chambers and people within the county that need to be there, like Betsy Hunley and Diane McCormick and some other people from the county to come in and do their presentations, we're at probably 20 people, which means 5 people can come in from the public. And so in order for us to come back into chambers, which I do not have a problem doing, we would still have to do a hybrid, meaning that we would be in meeting together, but the public would still be on the Zoom call. So some of those people who were on the call to public that said, I want to be face-to-face, I want to be there, you can't be there. We can't have all those people. Most of you have been to chambers. You see how big it is. I was there a few weeks ago and saw that they have, plastic shields up there. They were not all sitting together. We're kind of separated. So for me, as much as I want to get back, and I am not one of those, and I think I can speak for most people. I think that the commissioners like to be in chambers. We like that coming together. It's just like being with family. You want to be together. You don't want to be on Zoom calls and phone calls and talking to different people. You want to be in person. I think that's important. It's part of human nature. So, and I started thinking about, I'm a person of trying to find solutions all the time to dilemmas. And, as I was listening to different people on the call to public, and I heard Ms. Dubbenmeyer say something, and, and about, spending the money, and then you hear about you heard people talking about how this is affecting our local businesses and stuff. And as I was sitting there putting almost this together into a puzzle, I'm not saying this is the perfect solution, but Crystal Gardens is a pretty big place. And my thought was, if we were to hold meetings there and use that $37 million, we wouldn't give them $37 million to hold meetings there, but a portion of that as a use of for COVID purposes, and we bring everybody in there and we meet, there would be a lot of meetings because I'm on a couple committees. So there would be lots of meetings. Crystal Gardens would really have a lot of business from this. They would make money, which is good, because we want to support our local businesses. We would be together, and then we could bring in more people. But as Therese said earlier, there were like, and I put this down too, there were 60, 70 people on this call today. And we just never know when there's going to be 10, 20, 100. And so we have to accommodate that according to the Opens Meeting Act. So for me, I'm saying that I feel that we want to be safe. And for me, I'm okay with coming back into chambers with my colleagues. But I'm not okay with bringing a bunch of people from the public in there as well to track if someone were to have COVID and call us up about 2 weeks later and say, oh, by the way, I was at your meeting on Tuesday and I was diagnosed with COVID and I could have infected all these people sitting there in the county and the commissioners and people who are there doing presentations. So so I have concerns about that, but I am okay with coming back to chambers, but it would have to be on a hybrid type of program where the public isn't really there with us. It's either they're on Zoom or we find a much bigger location to hold the meetings where people can come in safely and be a part of this, to me, this great thing that we do every other Monday and then some. And that is all I have. Thank you, Mr. Chair.
Thank you, Commissioner Plank. Any other comments or questions from commissioners?
Mr. Chair, if I could.
Commissioner Zajac.
All right, so bear with me here. I'm going to be long. I'll just forewarn everyone. So I really appreciate the perspectives of all of our attendees. I appreciate the perspective of our commissioners as they've been displayed in the public safety. The response from council has been very prompt, and I've appreciated that as well. There's several things I'd like to go through, and I think there are many situations where we're using terms quite loosely to really blanket categorize certain things under the Open Meetings Act and certain things under this definition of virtual meeting. There's actually not a phrase virtual meeting in the Open Meetings Act that calls for an electronic meeting. And it actually addresses the members of the public body, not the public participants. So without getting into all of that nuance, I'm going to try and lay out a few things here for my colleagues and for the public. I've reviewed correspondence from the February 22nd meeting, from the March 8th meeting, from today's meeting, even with Berrien County's resolution and then the Toccola County resolution. So far, there's not been a single declaration that says we are in a state of emergency, therefore XYZ. My review of the correspondence from February 22nd included Huron, Jackson, Muskota, and Menominee. And from March 8th, Berrien, Crawford, Iron, and Otsego. Upon my review, there's only really been one county, and I know there's 80 plus total, but from the 15 or so that I've reviewed, Ingham County is the only one that's come out to say there is a state of emergency. And it's interesting to me that it's in the backyard of our governor. As an example, Ingham County schools until just this month were not in person. They only returned this month. Whereas in our county, schools have been really an example, as has been talked about by several members of the public today, of the capabilities to conduct in-person learning. We've advocated for our schools to be in person, and we've valued our teachers and our support staff and our administrators as frontline workers. But now we're considering a resolution whether to allow government workers to be allowed to work remotely, specifically elected officials, because I don't think there's anything necessarily that causes for concern in the Open Meetings Act other than the public body, which is the elected officials. The issue of declaring a state of emergency is one that I cannot support when it really is based on allowing remote participation from the elected officials primarily. When we can, in fact, meet in person, as has been just been discussed, as the elected body, but still provide means for public participation virtually in that public meeting. As I said, we use this word virtual meeting quite loosely and this word hybrid quite loosely, but there are situations that I think are being, as I said, grouped into those categories quite unfairly. The Open Meetings Act specifically identifies that there are different types of people that will meet in these public meetings. The open meetings issues that have been identified are not, both publicly and as throughout the discussion, both with our colleagues here as well as with council, are not items that I'm willing to subscribe to because they result from interpretations of the Open Meetings Act that I do not think can stand, and I'm unwilling to make those same interpretations. I do not agree, for instance, with the public opinion that the Open Meetings Act is somehow violated when capacity restrictions are a result of health directives. Assuming, just for the sake of argument, that these directives are valid, there is no open meeting issue based on capacity. There's no justification that can be presented for that. If in fact there is justification, my question is, why has it never been an issue before? I've stood in the hallway of our county building and our county offices when the previous Board of Commissioners took up the Second Amendment issue. I, in fact, was one of the folks that was standing in the hallway because shoulder-to-shoulder seating had run out and there was no more capacity for me to be in the meeting room itself. Similarly, the abortion issue was one brought before the prior Board of Commissioners, standing room only. And again, no Open Meetings Act issue, a question of capacity. Our colleagues from across the state have different size rooms, varying capacities, and yet the difference in those capacities do not present Open Meetings Act violation issues. There's no word or phrase within the Open Meeting Act that requires any sort of accommodation when capacity does become an issue. There is no connection between the Open Meetings Act and this resolution as we're presenting today because of the way we can continue to meet publicly. But we will be able to allow for virtual participation by the public, as we should now and even perhaps into the future. The Open Meetings Act requires in-person participation by the public body. That's us. Nowhere does it restrict additional access. And I would also like to quickly share my screen. See if I can do this without screwing it up. All right. Can everyone see my screen?
Mhm.
Yes.
Thank you. All right. This is the frequently asked questions webpage for the Michigan coronavirus most recent declaration. And there was a specific question about public meetings or board meetings permitted under the order as it relates to the 25 member gathering limit. So the question is, are public meetings or board meetings permitted under this order? The answer is yes. Up to 25 board members may gather for a meeting. Under Public Act 254 of 2020, public meetings may be conducted virtually for any reason through March 31st. We all know that. Now, the public may also attend the meeting in person, subject to all applicable masking and distancing requirements. For in-person attendance to be permitted beyond 25 persons, which suggests that it's allowed, the event must be designated or designed to ensure that persons not part of the same group maintain 6-foot distance from one another to the fullest extent possible. All meetings covered by the Open Meetings Act, whether conducted virtually or in person, must also comply with Public Act 254. So the purpose of me sharing that is to say that the 25-person limit is, again, one of these loosely used pieces of information that, in fact, is not required as we compare the Open Meetings Act and this potential extension of the emergency order. So we can, in fact, permit virtual participation for the public without any sort of issue. Further, my question becomes, what is the emergency as defined under MCL that exists in this situation versus any other situation we face within our county, whether it's a result of COVID or otherwise, whether it's suicides, overdose, heart disease, obesity, et cetera, the list goes on. There's not been any data, I have to agree, that shows why this situation is any different than any of those other situations, such that a substantially high death rate or any sort of other justification exists for the declaration. There's been discussion, at least in the public safety meeting, about a 10 death over a 1-week period. I don't know if that's exactly the right fact, but my question would be, how many other deaths have occurred over that same 1-week period? And are those cases of an emergency as well? The purpose of this emergency exception within the OMA is not to circumvent the OMA itself. I received, aside from the 2 comments tonight, 0 public comments asking for an emergency order. for anything other than where elected officials wished to participate virtually from some warmer climate. Now, I principally agree that elected officials certainly do get the opportunity to take a vacation now and then. And if in fact the OMA were written to allow for conducting remote business by the elected officials, that would be something worth discussing, but it is not as it's written today. So the enabling statute that lists this opportunity for local municipalities to declare states of emergency also has a whole list of other tools they may use in such situations, whether it be spending, power, control, provisions. It's quite a long list. In this regard, I actually am in a little bit of fear for our friend from Ingham County that joined us tonight, as their declaration actually discusses utilization to the fullest extent possible, all emergency operations within their emergency operations planning. Our declaration or our resolution actually is silent in this regard. It does mention that we hope to extend the meeting or extend the declaration so that we may be able to meet virtually. But I ask, what are the unintended, unknown, and corresponding consequences that may exist? Finally, trying to wrap up, our senator and our representatives are fighting over the overreach from Lansing declaring states of emergency when we've just discussed perhaps local control and local government and local control is in fact the best form of approach to these types of situations. I cannot vote to perpetuate such an overreach. I have called on our IT department and I've called on other folks within the county to answer the question of what need we do to address concerns with allowing people to be in the public audience, though it's not required under the OMA, so long as the capacity is not restricted intentionally by the public body. And I really do like Commissioner Plank's idea of Crystal Gardens as an opportunity to allow more in-person participation, though again, my reading and interpretation of the OMA, and I believe its application for its history does not call for it. I've also called on our county leaders to identify needs within the county, including creative opportunities to address issues within the county that involve the ability of the public to virtually participate in our government as we go forward, along with other creative solutions that aren't really at issue here. So to summarize, the OMA says must be open to the public, the public must be permitted to attend. Both of these are possible, and as I review and study the OMA and our current situation, they are no issue. A person must be permitted to address a meeting of the public body under rules established and recorded by the public body. That's the language from the OMA. Again, I see no circumvention of that rule by not declaring a public or a state of emergency and meeting in person. There is no definition of electronic meeting within the OMA. As I've said, there's no reference to a virtual meeting as it's been used. And the difference is noted within the OMA between a public body and members of the public who wish to participate electronically. We will make this virtual, we have the opportunity to make this virtual option available to the public. And when we start to see things be retracted from the state government with the 6 feet distancing requirements, again, no issue will be created by our question of capacity. I don't see any of these things as mutually exclusive. The idea of allowing virtual participation and the notion of protecting the safety of our constituents. We do know that the vaccine has been, for whatever reason, shortcoming in our county. This does not circumvent that problem or create conflict with our demand for answers in that problem, as we would still allow those that are most vulnerable, those that are not comfortable attending in person, to participate virtually. And I will yield the floor, Mr. Chair. Thank you.
Thank you, Commissioner Zajac. Are there other commissioners who wish to speak to this issue?
Mr. Chair.
Commissioner Lawrence, go ahead.
Thank you. Couple of questions and a couple of points. I'll start by saying that I represent Brighton Township and the city of Brighton, and I did reach out to both of them. Brighton Township last Monday passed a resolution that extended through July 4th of 2021. The city of Brighton wishes to have the county extend and for the city of Brighton to be covered under the umbrella. I'm just making that statement as those are the municipalities that I represent. Therese Cremonti had indicated that this resolution is strictly to conduct government business to meet virtually. So my question, because we had many comments in the call to the public, and I appreciated every single one of them, but they were extending this local state of emergency out a little bit. So if this were to pass, what effect does this local state of emergency have in any other form? Does it affect schools? Does it affect anything else besides us, the Livingston County government, to be able to meet virtually?
The only impact it would have on the schools, Ms. Lawrence, is if the schools wish to hold a committee meeting or a school district meeting virtually. They too can come under the same umbrella, but it has no other impacts and it has no intent to have any other impacts other than to be able to conduct business virtually.
All right.
And I will let you know that it was Brighton Township who did their own declaration, and that was posted with the state this afternoon by me.
Yep.
Any of the other jurisdictions that wish to post their own declaration may do so. I will handle those individually as that is part of my job description.
Thank you.
You're welcome.
Here's my next question. Let's take this scenario, and I agree. I miss going to the county. I miss meeting in person. I miss the camaraderie that we have. I miss all of that. Do I like to sit with my pajama bottoms on? Yeah, I do like that, but I can get over that. Okay. So here's my question. Let's say we're all back and we're all in the board chambers. It's not a real big place in there. So we still have the Michigan Department of Health and Human Services that say you still have to have, well, now it's 3 feet, or you still have to have that. So let's say the room is at capacity, which it has been in the past, but now there are other people that want to come in. Who is counting and who is stopping those people from entering the chambers? Who does that? That's my question. Nathan, do you have a response there?
Well, unless we assign other people to that, it would be me. When we had a hybrid meeting back in October, you may remember we had a large participation, and I think we had about 170 people, but thankfully that day, most of them were virtual. But we were prepared that night with ways to access the Zoom meeting via a flyer I was going to hand out. We were prepared to share the information on how they could connect otherwise. But I tend to think, given that experience, that most people would participate virtually if there's a virtual option. And we're looking for ways to have that be an ongoing part of our meetings. Now, that's going to be your decision as commissioners. These are your meetings, but we are researching options to have the public be able to participate virtually, moving forward if they'd like to. But, I frankly, don't want to cause additional staff to be here who didn't need to be here otherwise. And so I would likely be the one doing that. I was the one who did that night. But it raises some particular challenges. The talk about let's go to a bigger facility. Okay, I would be all for going to a bigger facility, but, and Matt, feel free to correct me if I'm wrong, but the legal interpretation that we saw said that you could have more than 25 people in a facility if individual rooms didn't exceed 25 people. So imagine a situation where we have 68 people tonight. Let's say this was in person. 25 people are in a room you're in. That leaves 43 more. So I would have to direct them to some overflow room where they can see, hear, and participate in the meeting. And then there's 18 people left, so I'll have to take them to another location with an overflow room where they can see, hear, and participate in the meeting. That's what would have happened for a meeting of this size to be held in person right now. And again, my guess is if there were a virtual option, we probably wouldn't be dealing with that. But we never know how many people are going to show up for a meeting, ever. An agenda that may look to be very light may end up having 100 people show up. We don't know what's going to happen. And so we have to be prepared for the worst case scenario in those situations. Another thing that I'll comment on is that, just before COVID hit, and I wasn't here, so I'm relaying conversations that were shared with me at the time, your chambers were being outfitted for more video technology. So you see there's TV screens in there now on the wall, there's cameras embedded into the wall. And so that room was being prepared to have more broadcast capabilities. It wasn't necessarily being prepared for Zoom meetings, but we've been working with Director Toby, and we can make that happen. We can take what's there now and configure it in a way that's going to be applicable to this. But we're not there comfortably right now. And so, if we go back to in-person meetings in the week after next, we will need to have some IT staff there as well to help us navigate the hybrid part, the cameras, the sound, and make sure that the meetings go smoothly. So there's a lot of different thoughts and opinions on it, but to answer your question, I would be in every meeting that you're in, and I would try to keep an eye on those things.
Okay, I did contact Director Toby today, and because here we are talking about the Board of Commissioners, but there are other committees that are formed in our government, subcommittees, all our subcommittees, the Airport Board, the DPW, the Veterans. So those are all other government functions that we have to consider as well. And so I asked Director Toby, to run a hybrid meeting, what do you in the IT department have to do to run these hybrid meetings if we were to open up? He would have to have a staff member at every single one of those meetings. There's additional equipment that he would need to purchase. And I guess I would ask Director Toby to please respond to what would be required for other committees that we have under our government. There you are.
Commissioner Lawrence and other commissioners, there would be a necessary purchase of additional equipment to facilitate the hybrid meetings. We've had one hybrid meeting to date so far, but I will say it was put together in a very rudimentary fashion. And for those that were present during that, we had problems with feedback because we were trying to do it off of a speakerphone and kind of making it happen without expending any extra funds there. Basically, we would have an expenditure of approximately $8,000 to $12,000, depending on the board's wishes to add that extra equipment to facilitate those Zoom meetings and to be present at those meetings, whether they were committee meetings or full board meetings. We would want to have a staff member that was there about an hour ahead of time to make sure that we could test everything and make sure that everything was fully functional. This way we could be in compliance with the Open Meeting Act and for about 15 to 20 minutes, maybe even 30 minutes afterwards. So.
Thank you. I was just curious what his department would have to do that does not normally have to do. So, and I want to say that I have seen more participation from the public since we have gone virtual and than I have ever seen in my 8 years of service to the county. So I do like that. But I just wanted to clarify, and I think part of it, and I'll make one more statement, the word emergency in this resolution, I think that is like a flashing light. Do we really have a local state of emergency? Is that the verbiage that has to be used? And I'll ask Teresa Cremante that.
That's all language from Act 390 of 1976. And so it's basically boilerplate. That's just how it's articulated.
Okay.
So, and that's what it's called.
All right. And I'll just finish by saying, I think the fact that our health department is just working round the clock. Part of me says, just let it go and let's finish up these next 2 months and then open the floodgates and be back to normal again. That's part of me saying that, but I understand what others are saying as well. I do want to get back to the chambers. That's all I have right now, Mr. Chair.
Thank you, Commissioner Lawrence. Are there other commissioners that wish to speak to the resolution?
Mr. Chairman.
Commissioner Griffith.
I truly appreciate all the conversation and the call to the public that happened today too. I think we've all had it. I think we all feel like we want to have something that's normal in our life or go back to that kind of routine. And I feel like we're almost there. I think I have to agree with what was said about the terminology emergency. I think that's now thrown a red flag that everybody is, because we're using that word, the sky is falling. But if that's the only terminology we can use, that's what we have to be cognitive that we know what we're talking about, obviously. Therese Cremonti, I think at Public Safety did an excellent job about conveying what this is all about to our committee members there. And it is in your packet that this is actually an umbrella under which local governments can operate. So I'm not looking at this resolution as just what we can do in our chambers, but offering this with the passage of this to our local governments that give them an option. It gives them the option, in my understanding, that they can operate the meeting the way that best suits them. So in other words, there are some townships, there are some cities, there are some big items that will probably have wide participation from constituents. And like them, like us, we don't know what those are, but they aren't equipped to have a place or the luxury of IT. This gives them the option that they can Zoom, they can have their meetings in person if they'd like, or the selection of a hybrid if they know how to protect their constituents in the space. So for me, part of this, I strongly weigh, is because we are giving the option to those local governments who are depending on us, that they need to have these options to continue to carry out the business that they need to achieve. You know, it's amazing what we have done in a year. None of us have ever Zoomed a year ago. Before this, we learned how to Zoom. We've learned how to communicate. We've hired a county administrator over Zoom. I mean, and a couple of the new commissioners have been elected over Zoom. We've made this work and we've worked effectively. One thing that I think that is key to this resolution is it has a sunset. This is for 60 more days. But it's not just about us. I want to get back into the chambers too. We do well in the chambers. It's hard to do the social distancing. And one other thing I just want to remind, this going back to the chambers can be a burden, not only on IT, but keep in mind that, the discussion we had before Zoom was, how do we clean the chambers? I mean, at that time we had janitorial services that weren't working, that we were short-staffed because of the budget with that. So we have to rely on our janitorial services too, to come in before meetings and after meetings. If somebody reports it and they have COVID, what are we going to do then? I mean, we really need to look at, do we quarantine then? Do we go to contact tracing? Are we going to then stop our meetings? There's a lot of unknowns here for 60 days. I guess I think that with this past resolution, we are assisting our other jurisdictions, our other 20 jurisdictions, and allowing them, this umbrella, to make the decision on their own. And we have 60 days to talk and determine what would be the best way that we can serve our constituents.
Thank you, Commissioner Griffith. Other commissioners that haven't spoken to this issue that wish to? Are there any more commissioners?
Mr. Chair. Oh, go ahead. Well, is there somebody else?
No, Commissioner Helserman, go ahead.
Okay, just I have a series of questions. First of all, the first question, maybe this is for Matt, does the Open Meetings Act give us the power to make this declaration about the Open Meetings Act? Where does the authority come to make this declaration? Does it come from the Open Meetings Act, or does it come from some other source? Matt, if you could address that. I think you're muted. I think you're still muted.
Sorry, we had that set up so the participants couldn't unmute themselves there for a minute. So Cindy had that under control. Thank you very much for unmuting me. Commissioner, we are using two things. So the recent amendment to the Open Meetings Act permits this to occur. So that is the OMA, but the source of authority to make the declaration is a separate state law. That is the one that Therese has been referencing, that is found at Act 390 of 1976. It's MCL 30.410.
Second question, the Michigan Department of Health has unlimited authority to write orders, health orders, that can only be vacated by them. They are the only ones. Is there any way besides the health department that can change their orders?
So a court of competent jurisdiction could change the order, or the legislature could change the scope of authority that they're currently operating under.
Okay, so in theory, they could say everybody in the state, it would be good for the health, necessary for the health of everybody to take an aspirin a day to keep their heart healthy. Is their limit only the limit of common sense?
No. I guess I shouldn't have skipped over what it is or is not unlimited. Their authority is defined by the statute. Whether or not they could impose a medication requirement, I don't necessarily want to render an opinion on the fly. As it relates to gathering restrictions, though, that does appear to be within the scope of their authority, in my opinion.
Yes, whether you can gather, that is, definitely said. Then our authority to declare an emergency through Therese and through that act, what are the limitations that we have? Because you say our authority to call Zoom meetings come from the Open Meetings Act. Are there any limitations? What are the limitations to the emergency that Therese could declare and we would ratify?
Well, it's prescribed by statute what can be covered in a local state of emergency. I'll just give one example. One of the things that can occur is you can issue directives as to travel restrictions on county or local roads. Obviously, this is an old statute. It would cover something like a pandemic, but it was really designed, it's my understanding of legislative history, for if you had a flood, if you had, it literally talks about threats or invasions, rescue operations. So it's a very broad-based scope of authorization here under the Emergency Management Act. But in this instance, we're operating with an amendment that came together very quickly. And I think that this likely came about as a compromise to having a certain window of time where the state would say that these would be permissible under the Open Meetings Act. And then a second window of time where if the local county or governmental entity wanted to declare an emergency, they could do so to avail themselves of this opportunity under the Open Meetings Act. So it's one of those things where, you know, not necessarily the original intent of this act, but they tied it to this provision in the amendment of the Open Meetings Act. And that's why we're here and that's why we're talking about it. Is it a little cumbersome? Yes, I think it is. But it is something that you can avail yourselves of if you'd like to.
Okay, then, okay. There are, you know, the health department there have been a lot of negative things happen because of the health department, you know, first of all, the governor and then the health department, their orders. Is there any way that the emergency caused by the health department of, you know, more deaths, you know, more suicides, more domestic violence and things like that, can that in itself be called an emergency and ask the Department of Health to withdraw their orders in Livingston County because of the devastation that they've caused to Livingston County?
Well, that would be likely fall within your legislative prerogative if the board did want to do something like that. It's not covered specifically by the statute, no.
Okay. I'm because, you know, I think like most everybody, I've reacted to the word emergency. And the first thing I said when I read this, I said, there, you know, in my humble opinion, there is trouble, there is difficulty, there's maybe danger, but I don't like the word emergency. And I don't know. I think many of us feel, at least I feel, that the state has overreached their authority, and in my mind, the emergency is with the state regulations. The state is asking us to do two different things. So no matter what we do, if we want open meetings, we will have to decide, you know, where are we going to shave the corners? The other thing is, if we're looking for a facility that would have rooms that would accommodate, if we can have a series of rooms that have 25 people in it, the EMS building is the one that's set up. There are 5 distinct rooms at least, maybe 6, that you could have 25 in each room. And I think it could be done. That's where I would suggest, if we were going to go back to meetings and we felt that the 25-person rule is our responsibility, then it seems to me that that's a way to do it. That would be the best venue, because our present board chambers, we couldn't do that. So those are my questions and comments. Thank you all, and thank you, Mr. Chair.
Thank you, Commissioner Helserman. Are there other commissioners who haven't spoken to the issue that would like to? I'm going to use this as an opportunity. The chair goes last, so I'll at least in this first round. Yeah, I will first state that I am opposed to the resolution. When the idea was presented to me and I first, thought about it, I gave it thought, because of the, at that time, the understanding that, local governments, I was being told that local governments couldn't declare their own emergency. I subsequently did an internet search for emergencies, and I saw that cities have declared emergencies relative to COVID, as have townships. So, in my view, if a local government, because I do believe in local control, if they want to, declare an emergency, they can do it. They do not need the county to do it for them. And so that strikes one of the reasons why it was under consideration. As I view the situation, and other commissioners might view it differently, but my view is that we are here today talking about this emergency resolution such that we can do a workaround of the Open Meetings Act. That is the crux of it for me. That's how I'm going to distill it, in my mind. I really do not think it's appropriate to declare an emergency to allow us to get around the Open Meetings Act. When there are alternatives that can be executed that would enable us to not do an emergency. Somebody earlier tonight referenced, the emergency might be like a threat or an invasion, type of scenario. And certainly those emergencies, if that were the case, if we were being threatened to, an invasion, or if we had a tornado rip through the area, I think that's very appropriate to consider declaring an emergency. To work around the Open Meetings Act, I'm not comfortable doing that. I think, if as I see it, proponents of passing this are concerned about legal jeopardy that the county might be in, but because we might potentially violate the Open Meetings Act, which I don't agree with. I concur with Commissioner Zajak's point of view, and I appreciated him showing that screenshot, with the exact language that he did. It further convinces me that we have latitude to address the Open Meetings Act and potential issues. I like the comment about, if we had to meet either in Crystal Gardens or in the EMS building, meet in a larger venue. I'm for that. I want to err on the side of preserving liberty and rights for the citizens of this county. That's my biggest focus. In fact, that's a bigger focus right now than saving the taxpayers' dollars. I mean, we are in my view, unprecedented times, and I don't want to be contributing to further eroding rights of citizens. Let me give you a couple of examples that happened with respect to this resolution. I had a conversation with a citizen who brought up we were talking about unintended consequences, and so the citizen brought up to me, could a teachers union in Livingston County potentially use this emergency if it were declared as a reason to not go back to work full time, or scale back from 5 days a week to 4 days a week. I think they could. I'm concerned about that possibility, and I don't want to contribute to that potential possibility. A second one of unintended consequences is that there was a protest held, as I understand it today, at a venue other than the county commission building, because the county commissioners aren't meeting in person. And, so the ability of citizens to petition or protest their government, we are, by not meeting in person, we are restricting their rights. And I think as a governmental official, somebody who elected to represent the people, of top priority to me is to preserve their rights and liberties. And I see this passage of this emergency resolution as infringing upon that, and therefore I cannot support it. So thank you for allowing me the chance to speak on the issue or listening to me. We'll go around a second time if there's any follow-up questions or comments from commissioners.
Mr. Chair?
Chair.
Commissioner Plank.
I also am not going to support this, but my question is the timeline that we are on to get things in place, the resources in place, the notifications to the public if we decide to go off campus, as you will. What are we looking at? I mean, would the meetings start back up in person, say next week, or do we have a time period in which we can put things in place? All the notifications that need to go out, is that a couple of weeks? What does that look like?
I would see if Administrator Byrd would chime in on that question.
Yeah, without a declaration in place, you will be back in person April 5th for the general government meeting and every meeting thereafter. There's not an option for you not to be meeting in person without an emergency declaration in place. And so whatever format we come up with, whatever location we come up with, it'll need to be ready April 5th. Now, I don't believe that there will be subcommittee or board committee meetings in person prior to the 5th, but I would want to check on that because they also will not be permitted to meet in person, or will not be permitted to meet electronically without a declaration. So April 5th would be the target date for you all. As for the other public bodies that work through the county, I'm not sure exactly what all their schedules will be those first couple of days of April, but anything after March 31st, any public meeting will be required to be in person at that point.
Okay. Thank you, Nathan.
Mr. Chairman.
Commissioner Plank, or were you?
I'm all set. Thank you.
Okay. Commissioner Gross.
Thank you, Mr. Chairman. As Administrator Byrd just mentioned, the first opportunity for us to have an open meeting, not virtual, will be April 5th, unless there are any others. It strikes me as being somewhat disingenuous that here we are 9 days to go for the expiration of the state law governing the situation, and we haven't bothered to explore the metrics, the mechanics, whatever, of having open meetings or in a larger venue. I've heard mention of Crystal Gardens, which in my opinion is overkill. That place is huge. Maybe there's some schoolroom someplace, but if we were forced to have this meeting tonight for 68 people, not counting the commissioners and support staff and so forth, it would have been almost impossible. And I don't view this resolution as infringing on anybody's rights. It's something that some of our constituents want us to do. The officials in Hamburg Township want me to vote in favor of this. Regardless of what their rationale is, what their reasoning is, they've expressed that that desire to meet. And I'm sure some of the other jurisdictions similarly would like us to take action. I think we're pretty much beyond the point of other considerations, and at this point in time, I think we need to go ahead. Granted, the term emergency is suspect, if you will, but just given the circumstances of where we are and what we need to do to facilitate doing our jobs for our constituents, for the public, continuing virtually for 60 days, I see that as not burdensome or illegal or unwarranted. Thank you.
Thank you, Commissioner Gross. Other commissioners have a follow-up comment, question? Commissioner Reeder.
Well, I've listened to everybody today. I've listened to the public. I've talked to Deerfield Township. They have been meeting in person, even against what everything else was said, because they have the area that they can do that, and they only have about 10 people show up for their meetings.
Mm-hmm.
But that's not the case with us.
Yep.
I want to be in the chambers too. I'd like to sit in my seat at least once since I've been elected. But that hasn't happened. And it will. But you have to understand that this is going to cost money. Administrator Byrd said, what, between $8,000 and $10,000. So my question is, does IT have enough time in 9 days to bring that around so that we can have a meeting that is done properly with the proper communications, or not? If you put it in another venue, who's going to do the maintenance? Who's going to install all the equipment that needs to go in place for us to have a meeting such as that? And I don't think we're thinking about all that. It's complicated. It's not just let's move the meeting to the EMS building. So my question is basically, is there enough time, and where's the money coming from? Or is this what we're going to take money out of the COVID money from the county to do this? I think the trade-off for another 60 days is kind of a no-brainer, because are you going to expend $10,000, $12,000 and then go back to the chambers at the end of the 60 days and not have any of these restrictions? I'm conflicted. I don't know. That's all my comments are.
Thank you, Commissioner Reeder.
Mr. Chair, point of order. Was that a question, Commissioner Reeder, you wanted answered, or was it rhetorical?
It was a question.
Sorry.
Do we have enough time to get this done? Do we have the money to do it? Where's it coming from?
Well, if I could comment on that, if you decided that you wanted the April 5th general government meeting to be in person only, then, you can do that. And we just will have to hope that we don't surpass the 25 number limit. We pulled off, I should say IT pulled off a hybrid meeting on very short notice back in October. It wasn't great, but it worked well enough to have the meeting go. And so, yeah, we can do that. If that's, I've spoken on this 3 Mondays in a row, and each week I've said that whatever you want to do is what we'll do, because these are your meetings. And so we'll make happen what we need to make happen within reason. I also just want to point out that we haven't received a single red penny yet of the rescue fund money. And so not only that, but we haven't received the documentation from Treasury about what the stipulations are and what the eligible uses are. We've seen the analysis, we've seen the breakdowns, we know it's going to be coming, but that money's not there to spend yet. If we did want to expend some money now, I would probably authorize that through contingency funds. I have the ability to do that up to $25,000. And, Director Toby mentioned possibly 8 to 12 to allow us to have some sort of a permanent Zoom feature. But again, that was focused on the chambers. We would need to come up with something that would work wherever we end up meeting. But we can make this happen because we'll be required to make it happen. It just there might be a couple bumps along the road. And my bigger concern is just all the other public bodies. IT will be at your meetings if they need to be. I'm not sure we can spread everybody around until we have a permanent fix in place comfortably with all the other public meetings that go through our boards and committees. But we will do what we have to do to make this work if this doesn't pass tonight.
Thank you.
Mr. Chairman, if I may.
Let me, Commissioner Gross, let me just see if other commissioners who haven't done a follow-up are interested in doing a follow-up.
Mr. Chair, I'd like a follow-up comment, please.
Commissioner Zajac.
Thank you, Mr. Chair. Again, I really appreciate this discussion. I think that this emphasizes the ability of this board to have good dialogue, though opinions differ on a topic. It's another example that we've shown. So doing it in person will only be that much more exciting, and I promise to bring some donuts or popcorn or whatever to go along with that. I just want to clarify a few things and make some rebuttal comment, and then I'll stop, yield the floor. I agree from a legal review perspective with the chair in his interpretation of the items that he read. First and foremost, there's nothing in the OMA that calls for public accommodation, and I would be troubled not troubled. I would be interested in seeing what sort of legal interpretation exists in such a situation, considering the only pandemic that I'm aware of was in 1918 and the internet was not around at that point. So I see a conflict there that I just can't reconcile within my brain. Also, the umbrella discussion, I agree with the chair again that each village, as we've seen from Brighton, and I believe Ms. Cremante, you'll be getting some information from the village of Pinckney, who I spoke to. They don't have the ability for their entire board to be able to meet in a room and honor the distancing requirements. So that is why they will be, as I understand it, issuing an emergency order locally. And like Commissioner Gross, whether we agree or disagree with their decisions, they are the local government, and I believe that they should have the local control. They have the option with or without our declaration to make whatever decision they see fit. I would be concerned with our position taking that we create this kind of trickle down governing, because my concern is not with this group, because I don't fear it with this group, but we set a precedent for future groups to impose their will upon the localities. Imagine a situation where we believe as a commission that pole barn walls should not be larger than 12 feet because of some reason. Are we saying we can carve that out of this ability to trickle down govern? I think that creates a slippery slope. From the perspective of spending the money, I'm traditionally a fiscal conservative, and I will remain as such, but I know that there's concern that the money's not showed up yet, but a fraction of 12,000, 37.2 million, it seems a worthwhile fraction to consider. And I would argue that as we go forward in a virtual environment, that it creates further opportunity. Perhaps even though I love meeting with our colleagues from SEMCOG, it's a long drive from Detroit, and I don't believe there's anything that suggests somebody couldn't present that's not a part of the public body in a meeting virtually. So are there opportunities for that as we spend this money that we could look to as a really precedent-setting move for the county as we look to improve upon our infrastructure and take advantage of opportunities? I cannot fathom interpretation of the OMA as our council said, quickly put together in an attempt to address a short-term solution to a problem. I cannot imagine a situation where a senator proposing such legislation from our county would ever want to open up the workaround type of opportunities. I've not spoken to her, but I know our senator well enough that workarounds are not something she believes in, though she may have supported this previous amendments. there was comment about restriction of travel, and I believe I heard Mr. Northford say that there is statute that exists that under a local state of emergency, there's opportunity for restriction of travel. Did I hear that correctly?
Yes.
Okay. I cannot sign up for such a situation. I understand MCL 30.402 discusses local states of emergency and the control that is given under certain plans of emergency and different things that are controlled within the county that we've not discussed as a part of this. And I think we would be ill-advised to make an action without fully comprehending those consequences. I would be in favor of allowing other boards to meet in our chambers if it's the only one that's allowed or that's set up for Zoom capability, and that's what they need in order to have a public body meet to allow for virtual participation. Again, I cannot fathom an understanding of the OMA that would suggest that there's a violation of the OMA based on capacity restrictions, because again, we would have violated it long ago. And my last comment, I guess I understand that we would need the ability to meet in person. We would need to somehow declare whether it be through resolution, we would need to allow for public participation in virtual settings for a otherwise public meeting. Is that what I heard you say, Nathan?
Allowing public participation, yeah.
In a virtual setting, we would need to otherwise take some action that would say we're going to continue to Zoom our meeting even though it's public, even though it's
Yeah, when we post our meeting agendas and our meeting notices, the way we did this back in October is we had a physical address and a Zoom address. It was a hybrid meeting. And so commissioners came physically. I think we only had one person from the public that also opted to go that route. Yep. And then the Zoom information was also posted. The OMA is very clear about noticing meetings that have a virtual angle. And so that's how we would do that. It would all be available on our website as it is now. There would just be a physical address also included on the notice.
Thank you. Mr. Chair, I have no other comments. Thank you.
There are follow-up questions or comments from commissioners who haven't had a follow-up yet, who wish to have a follow-up.
Mr. Nakagiri, I am not a commissioner, but if I could just clarify a couple of points that Mr. Zajac mentioned, if that's okay.
Sure. Go ahead.
Okay, I just wanted to, under Act 390, I just wanted to be clear that there's not a trickle down. If we set out a declaration at any time for this or any other type of incident, our shelter under that declaration is voluntary. It's not mandatory ever. So there's not a trickle down. It's literally a shelter. There will be county resources utilized if they do their own independent declarations, and that resource, that would be me, because I will manage and I will have to vet every single declaration that come through. We have 20 jurisdictions, so it could be 20, it could be 10, it could be 16. Regardless, that will come through the emergency management office so that I can look at it, vet it, set it to the state. Then I need to manage it to make sure that it is renewed or rescinded, as they can put whatever dates is good for their particular jurisdiction. So there will be some county involvement on that level. And lastly, even though a declaration does give powers to the local county, those powers will never go beyond the scope of what is decided by the board. So although Mr. Norford had mentioned that certainly there could be travel restrictions during some type of an emergency or disaster, there's two different types. Unless that is sanctioned by the board and then signed by our chair, the declaration never will go beyond the scope of what has been put in the declaration. And in this case, it's simply to be able to meet virtually. So I just wanted to clarify that it's not as overreaching as maybe what you might believe. And lastly, I'd like to say that this is simply a resource. This declaration is simply to reach into a resource to be available for the county. And if whatever the board decides to utilize that resource or not, that's okay. It's simply a tool that we have an option to utilize. And if the board chooses to not, that is okay. Thank you, sir.
Follow up from commissioners who haven't had a follow-up. Commissioner Helserman, did you have your hand up?
Yeah, I need my second round. First of all, I understand that the OMA does allow for Zoom. That Zoom is always an option. That's what I understand. Secondly, commissioners can participate by Zoom, but they cannot vote by Zoom. You know, and I don't know why we'd want to participate without voting, but that is also an option. I am all in favor of emergency declarations with unlimited power to take care of the declaration. The governor of our state should have the authority if Michigan is invaded some way, the governor does need that authority to act quickly. I have no problem with the governor, whoever it is, having that authority. The question is how long do they keep that authority, and do they exercise the authority beyond the point where they need to? And I think we've found the answer in Michigan. And the same with the authority that comes through Therese. That has to be a very broad power, because you never know what is going to happen. I have absolutely no problem with Therese and the law giving that kind of power. I just see that COVID is a gift that will keep on giving. COVID, the common cold is a COVID virus. And the reason we cannot find a cure for the common cold is because it mutates so often that there is no final solution. There's no way to find a good solution for the common cold. And it's not going to surprise me if we find all kinds of COVID variants, because that's, if I understand it correctly, that's the nature of the COVID. And my question is, whenever we make this decision, it will be a jump. It will be a leap. There will be risk. And maybe we'll make this jump too quick. But it seems to me that it is the time to make that jump, to take the risk, to work out these things. I think it's possible because we're going to be dealing with COVID for much longer than any of us think. You know, I predict it's not going to end it's not going to end until the people say, we have the power to run our lives and take the risks that we want to take. There's always going to be risks. There's always going to be risks with COVID. In my mind, I'm ready to take that leap right now and say, let's start the healing process. and deal with it the best that we can. And I think Livingston County is in the best position to do that. Thank you, Mr. Chair.
Thank you, Commissioner Helserman. I see Commissioner Plank has her hand up, but I'm going to go around and make sure everybody's got a follow-up comment, and then, by rule, it's we get two cracks at the discussion, but for this monumental issue, we'll allow a third crack at it. I would just ask commissioners to if you have points that haven't been made before, that have not been discussed before, certainly, I think all commissioners would be interested in those perspectives. So any other follow-up comments from commissioners? Commissioner Lawrence.
Thank you. I just want to say that about a month ago, maybe it was 45 days ago, we talked about how Livingston County was low on the totem pole and we weren't getting our share of vaccination. And now I look at that as Diane and her department have been plugging along. And there is a sunset here, and we're only looking at 2 more months. And I really feel that we can get a lot more vaccinations under our belt in the next 2 months. And then I would be very comfortable with saying, I'm done with it. But we're on the train and it's moving, and I don't want to just stop the train. I'd rather see what 2 more months bring us and then be done with it. That's all I have.
Thank you, Commissioner Lawrence. Any other follow-up questions, comments? I'm going to go and do my follow-up comments, and then I'll then I think Commissioner Gross and Commissioner Plank had some other items. So with regards to the money, the spending of $8,000 to $12,000, I'm quite confident that it is money. My opinion is it's money well spent. We are using that money to preserve the rights of our citizens, and I think that's for me, as in my value analysis, I think it's good value. While we don't have the $37 million in hand from the Department of Treasury, I'm quite confident that we will get at least a portion of that. And even if it's just half, we'll have $18 million. It is supposed to be used for COVID-related stuff. This certainly is COVID related. I'm confident that we'll have be able to use non-general fund dollars for this expenditure. How we deal with this emergency sets precedent into the future. We may not think so, but others may disagree. I think it sets precedent, and so the precedent we're setting, in my view, is, hey, we're trying to do a workaround for the Open Meetings Act. So I just want to share this. Some might view this as far-fetched. Perhaps it is, but I could actually envision this happening. There are counties around us that have designated racism as a public health crisis. Could I extrapolate that and say there could be counties that say that global warming is a public health crisis or emergency? Yeah, I can envision that happening at some point down the road. Whether it's in the near future or a little bit distant, I don't know, but I could envision that happening. Could I envision a board of commissioners somewhere along the line saying, whether it's not necessarily here in Livingston, I hope that never happens in Livingston in the future, but hey, we've got global warming as a public health crisis. Let's declare an emergency, and so that we don't have to drive into the Board of Commissioners chambers and contribute to greenhouse gases. It's going to contribute to this public health crisis. Yeah, in these days and the political views out there, yes, I could see that happening. I'm concerned that we are setting setting a bad precedent. And I don't want to be part of contributing to that precedent. With regards, and my last point to, you know, the public health aspects of this thing, we will be following all of the guidelines, all of the requirements that the state health department has laid out for us. Yes, they are going to be not as convenient as, you know, continuing to meet by Zoom. There is cost, there is rigmarole involved, but for me, in my equation, as I balance out things in my own mind, it is, we need to stand up for liberty. We need to stand up for the rights of our citizens to either come in person if they so desire, or if they're concerned about COVID, that they can Zoom in, because we're going to be doing both. You know, we'll be meeting in person and we're allowing Zoom. I think the in-person meetings, allowing people to Zoom in, it meets the needs of all citizens, those who are concerned about health, those that are concerned about freedom. I think it covers the whole spectrum. All citizens are covered. And that's all I have. And I'll turn over the floor to, I think, Commissioner Gross for a final comment, and then Commissioner Plank. And then I would like to call for a vote.
Thank you, Mr. Chairman. I tend to disagree with you, Mr. Chairman, on most recent remarks, in that if we do not pass this resolution, that means that our next meeting will be in person. And there's nothing in this resolution that says we can go to hybrid. So that would require some other action by this board. I don't know whether that would happen tonight or when it would happen, but this resolution in front of us is basically all or nothing, in person or Zoom for the next 60 days. There's been nothing said about going hybrid. So I think we have to vote on it as it stands. And once that vote is tallied, then we will have to decide what is the next step. Thank you.
Commissioner Plank.
Well, I was just thinking back about my company, and we have COVID calls all the time talking about what's going on in Michigan. And it dawned on me that we were following, I think it was MIOSHA, where they recommended if your employees can work remotely, they wanted them to work remotely. And I remember back in March timeframe, this time last year, our company made arrangements in Livonia to send about 140 people home with laptops to work from home so that they wouldn't congregate and be together. So I don't know if, working remotely is something, instead of declaring an emergency, is that something that if you're not an essential worker and you have to be at your place of employment, does it make sense to maybe follow that guideline and change it up a little bit? I'm just asking. Matt may want to weigh in on this, but I'm wondering if we don't have to declare an emergency, and we just follow the MIOSHA that says if your employees can work remotely, then you make arrangements to do that. And I do believe that the county has some people who are following that. I know my company is following that. I've seen people working remotely, people I work with daily across, Michigan, same sort of thing. So I'm asking, is it necessary to declare an emergency to continue to meet remotely? If you look at this as more of like we're employees of the county than elected officials, but kind of new at this whole election thing, and an elected official. So I'm going to ask Matt for his opinion on that.
So the short answer is no, but I understand where you're coming from. And you did kind of hit the nail on the head with the commissioners, the elected officials are not employees of the county. So that would not apply to you. As it relates to your direct report, like Nathan, it would apply to Nathan. And so if you wanted to encourage him to work remotely, you could certainly do that. But under the Open Meetings Act provision that we're discussing, that would not permit the Board of Commissioners to continue to meet virtually after the 31st under the current state of affairs, absent local declaration of emergency.
Okay, I was just trying to find something to smooth out this whole thing, trying to find a solution to make everyone happy, but I guess that won't work. So thank you, Nathan. And that's all I have. Thank you, Mr. Chair.
I think everybody's had a chance for initial comment and a follow-up comment. Commissioner Drick.
I believe Commissioner Gross might be happy to know that on page 7 of our commission rules, it says that any meeting held virtually, in person, or hybrid format in 2021 shall be held in accordance with the Open Meetings Act, which in my opinion probably gives us the go-ahead to do hybrids without another resolution anywhere. And my other notion is we own the EMS building. There are 3 huge rooms there that seat 60, 70 people each. We own the old county courthouse on the 2nd floor of the old courthouse building. That room seats at least 80 to 90 people. Even elementary schools have gymnasiums and auditoriums where they have large gatherings of people. They do graduations. The school board meets in these large auditoriums. And there are a lot of public places. Crystal charges $1,000 per room. So if you want to rent all 4 rooms, you're in the neighborhood of $4K. So that probably isn't the most, it isn't the cheapest place to meet. So I'd like to make sure everyone understands those things. Thank you.
Thank you, Commissioner Drick. I'm going to go ahead and close the discussion
Mr. Chair, point of order. I'd like to make a motion to amend the resolution. I've just emailed the commissioners, the administrator, Ms. Katnack, Ms. Tremonte, my proposed amendment, because I agree with Commissioner Gross. Traveling without direction is a wasted effort, without question. So I move to amend as presented in my email correspondence, which I can certainly bring up on the screen for those to consider if they wish to support it.
Yes, if you could share your screen and so we could read the amendment, that would be optimum.
It addresses the title as well as the therefore be it resolved.
So could you read through what, I mean, is it the things in bold that are changes?
Yes, I'm happy to read it, Mr. Chair, if that would be helpful.
Yeah.
Okay, so the first amendment I propose is striking the title and replacing it with resolution authorizing participation in Livingston County government meetings by the public by virtual means. The second amendment is to strike the final therefore be it further resolved. The third amendment is to revise and amend the be it further resolved to say therefore be it resolved that the Livingston County Board of Commissioners hereby authorizes participation in Livingston County government meetings by the public in order to protect the safety, health, and well-being of the public and government officials while the Board of Commissioners conducts business via in-person meetings. And I apologize, it should have said via virtual means at the end of that amendment. So that should end, number 3 should end via virtual means. Number 4, to amend the second, therefore be it further resolved as follows. Therefore be it further resolved that the action taken by the Livingston County Board of Commissioners in this resolution does not in any way affect the ability of the municipalities within the county to issue their own state of emergency declarations should the local facts and circumstances warrant in the discretion of local officials subject to their local control. And final proposed amendment, sorry, the videos are in the way here. The final proposed amendment is number 5, adding a new, therefore be it further resolved that the Livingston County Board of Commissioners declares that no state of emergency exists at this time.
Commissioner Zajac, just to be clear, you are making a motion to amend the resolution with the 5 amendments or the 5 changes that you have listed on your screen. Is that correct?
That's correct, including the addition of via further means here in the end of number 3, or via virtual means at the end of number 3. I apologize for that typo.
So there's a motion to amend the resolution on the floor. Is there support? I'll support the resolution for purposes of discussion.
Mr. Chairman?
Yes, Commissioner Helserman.
Does Mitch want to speak first?
Could you repeat that?
Does Mitch want to speak first?
Yes,
His amendment.
Yes. Yeah.
Thank you, Mr. Chair. Thank you, Commissioner Helserman. The only purpose of this amendment is, I agree with Commissioner Gross that we have to have some sort of direction. I heard the comments from our administrator with regard to, it was unclear if there could be virtual participation. So I believed that that required further direction. And this amendment would would not declare a state of emergency. It would obviously be in line with all of the discussion that's had earlier tonight, the commissioners meeting in person, and it would create the opportunity for virtual participation by the public as a means to continue if they, as a result of this situation, feel unsafe coming in person.
Questions from commissioners? Comments?
Mr. Chair, this is Commissioner Lawrence. I have a question on number 1, the strike the title and replace with. I would ask our emergency manager, Therese Cremonte, to opine on that. Hello?
Therese, still there?
I am. I apologize. I had to run out for just a moment. I'm sorry, Ms. Lawrence. I know you asked a question. What was the question, ma'am?
The question was, before you are amendments that were made by Commissioner Zajac. The first one is to strike the title and replace with resolution authorizing participation in Livingston County government meetings by the public by virtual means. So, Mr. Zajac, Commissioner Zajac, this is removing resolution authorizing Livingston County to declare a local state of emergency. You're removing that title. Is that correct?
Yeah. Yes, Madam Commissioner.
Okay. So my question then is to our emergency manager, Therese Cremonte. Does that language suffice what we're trying to do here?
Well, my question is, are you still trying to have a virtual meeting option, but without making a declaration? That's, I guess, what I'm asking.
No, this would not allow for a virtual meeting. This would be a public in-person meeting by the commissioners, and it would authorize public to participate virtually.
And I would have to ask Matt this because I'm unclear as to whether a hybrid still requires the declaration. So that's my question, because the only thing I have a concern with is number 5, to say that that you declare that there is no state of emergency at this time. Because part of that virtual capability, my understanding was that there needs to be in place an emergency declaration or disaster declaration.
To be clear, just before Matt provides his answer, this is not a proposal for a hybrid meeting. This is a in-person meeting that allows for non-public body members, which are the non-elected officials, to join in and have two-way communication should they want to via virtual means. This is not, as written, an attempt at a hybrid meeting. It is a in-person meeting.
That's hybrid.
It's still hybrid.
No, so what the hybrid, whether it's hybrid or not, is your participation as commissioners.
All right.
This would not permit you to participate virtually in a public meeting. It is encouraging and authorizing public participation. It's still not mandating public participation in a virtual meeting. It is making it clear that the option is to be available to the public. It is not a declaration of emergency as amended, and it would not permit you to avail yourselves of the to participate and vote individually as commissioners via Zoom.
May I please ask a question that I think will be helpful?
Go ahead, Mr. Byrd.
And the question is to Commissioner Zajac. Commissioner Zajac, is the intent here that the 9 of you will be in person and everybody else will be virtual?
No, the intent is the 9 of us will be in person, and as much capacity as the room has, they may be public, or they may be in person, and otherwise it's treated as any other public meeting would have been historically, where its availability within room is based solely on capacity.
Okay, that was my question. The way I read it, I thought that it was requiring the public to participate virtually while you were in person, and that was going to raise some challenges for me as the person who has to watch the door. So, okay, I understand that.
Still gonna have to watch the door.
Yeah, still gonna have to watch the door. Still gonna have overflow room. That'll all be the same. But I just wanted clarity as to how many people we were talking about being in the room at one time, and I understand that now.
Mr. Chair, let's respond to that really quick.
Yeah, go ahead, Commissioner Zajac.
I don't believe that the requirement of an overflow room is triggered. I do believe that watching the door, of course, we have to have 6-foot space between everyone who comes in. But I don't believe there's any difference here for triggering an overflow room than there would be if the public could come to their own conclusion that they couldn't walk in because every seat was taken. So I don't see this as any sort of trigger of additional space required, so long as it's truly capacity, specifically triggering the non-access to the room.
But if we have a situation, if I may, we can't get more than about 13 seats in the room with social distancing, because right now the commissioners are separated. You're not at one table, you're at 2 tables, because we can't have social distancing between commissioners at one table. And so the room right now has 2 tables, one that's half moon in the back where you would normally sit, and then one that's in the front. And so we will not be able to accommodate 25 guests in the room. And I just want to make sure that's clear, that we really won't be able to get that many people in if we strive to achieve social distancing because of the way the room is set up right now. And so, again, that's why I think it does constitute a need to be prepared for additional space in the building, because it's not a large group that we can get in the way the room's set up right now. And we don't have an avenue to go back to the old setup for commissioners without blatantly violating the social distancing requirements.
I would proffer, if I may, Mr. Chair.
Yes, go ahead.
That it triggers no different circumstance than had there been 70 people in the room previously and having to figure out what to do with number 71 once the room was full. They would stand in the hallway, as I mentioned, I've done, and as many others have done, and it triggers no additional burden on the county to satisfy OMA in my assessment. The situation is the same.
Other questions regarding the amendment, commissioners?
Mr. Chair,
Go ahead.
If I could.
Yes, go ahead, Commissioner Helserman.
This is basically changing a no vote to a yes, because basically you are taking, this roughly the same idea and saying it in the negative of the other way. So those who would vote no in the last vote would probably vote yes here and vice versa, because basically it's the same. You know, if what Commissioner Drick said is correct, and I have no question that he has it right, that we our rules allow virtual participation by the public. And so in my mind, this kind of it just makes you vote no if you're going to vote yes, or yes if you're going to vote no. I don't think it adds or changes the conversation.
Mr. Chair, if I could respond.
Yes. Go ahead, Commissioner Zajac.
I believe Commissioner Helserman in concept that is what occurs, but I also think that this amendment adds clarity as to number 5, making clear there is no statement of state of emergency. And then I haven't looked since Commissioner Drick brought up that rule within our board packet, if it allows for public virtual participation. I thought it only addressed board participation. So nonetheless, I think this is just a clarifying what it is that will occur on April 5th.
Other questions on the amendment?
One more clarification, please.
Yes, Commissioner Lawrence, go ahead.
All right. I just want to make sure, and I want to vote properly, so I want to make sure I understand, and we're going back to that first line. Come April 5th, and every meeting thereafter, every commissioner, whether it's a committee or a full board or finance, we will all be there. However, the public has the means to talk to us virtually, correct?
Madam Commissioner, that is my intent,
Okay.
though there may be stumbling language.
All right, thank you. Because I thought I heard something different, so I just wanted to clarify what this meant. And this will require our IT department, no matter what committee is meeting, to have an employee there and set up, that concerns me. Does the IT department have the staff to do that? That's my only question, but I'm leaning more towards approving this amendment. So thank you.
Would you like Commissioner Lawrence, were you seeking an answer from Director Toby regarding the staffing?
I would.
I can't see who's on because of the shared screen, but if Director Toby is still on, if he could address.
Probably went to bed. Oh, there you are.
Thank you, Commissioner Lawrence. Our team is thin right now, especially considering what we're trying to do during the pandemic. We will make whatever wishes the commission wants to make people available for this. This would probably be outside of a normal day for some members of our team, but we can allocate, some people to make this happen.
But it's not just the Board of Commissioners, it's every other committee and board for the county. It's the DPW, it's the Veterans Committee, it's Airport Board. So we're really placing, if you ask me, a large burden upon our IT department. not so much the dollar amount that he needs for the new equipment, but the staffing. That's my concern.
Madam Chair, or Madam Commissioner, with the additional meetings, we definitely, that I was taking into account the board meetings and the board committees to have the other different governing boards meet in chamber there would definitely, we'd be pulling resources. There's no doubt about that.
Mr. Chairman.
I can't see who yes, go ahead, whoever.
It's Commissioner Gross here.
Okay, Commissioner Gross, go ahead.
And to echo Commissioner Lawrence's comments, it's not just the IT department, it's all of our support staff, the county clerk individual, everybody who's connected with running a board meeting in chambers is going to be required to be there. It's a lot more than just a few $1,000s for equipment. And then it's the custodial staff to clean the facility, probably before and after. This is an undertaking, and it's not going to be that easy. I hate to think of what's going to happen on April 5th. Thank you.
Mr. Chair, because my amendment, can I respond?
Yes, go ahead.
I would say first, perhaps we should have taken more consideration of this beginning January 1 with the new board, knowing that at some point this was going to come to a head. And I think that it's going to come to a head in 2 months anyways, nonetheless. So I'm with Commissioner Helserman on addressing it now. But as it relates to the comment about the participation in the meetings by support staff, if I understand Mr. Nordford's comments correctly, we could certainly designate any one of those supporters. Ms. Katnack, as an example, who runs our Zoom. I don't know why she would have to be in person. Perhaps she chose to. Clerk Hunley, I think the same is true. I think she may choose to be in person or not, but nonetheless, I don't think we would require it to be so. And Open Meetings Act addresses only the public body. So it's on us to find a solution. And I would volunteer to be cleaning service after commission meetings, if that's the only hurdle.
Other questions, comments on the amendment?
Commissioner Nakagiri, Carol Griffith.
Commissioner Griffith, go ahead.
I'm just kind of looking at this and I'm thinking all the complications here, and we're all trying to think out of the box, who it's going to take and what it's going to take and the resources it's going to take and all of the different committees we have and all of the county, and we don't know how. We're talking about 60 days here. We've got a sunset, if not before, no later than May 31st. I guess I think we're making this more complicated than it needs to be.
I agree.
Thank you, Commissioner Griffith. Other final comments, questions before we vote on the amendment?
Mr. Chair.
Commissioner Plank, go ahead.
I'm going to agree with Carol Griffith. I really want to vote against this, but I think 60 days is going to go by fast. I hope that between now and that 60 days, we have all these issues that we've addressed resolved, because it is going to come to an end. And I agree with what Commissioner Zajac said just a few seconds ago. So for me, I don't want to, for some, for several reasons, but I don't want to be that person who's, putting Nathan or anybody else at risk and checking names at the door. 60 days is going to fly by. And so I'm going to change my mind, and I feel like that's going to go fast. But I really do hope that between now and then that we have addressed all of these issues, and we're in a better place, that we're all in agreement, that we're ready to come back. Maybe we'll get lucky and the governor or whoever's making the calls there says next week or 2 weeks from now, we can have 100 people together and then we won't even have an issue. And we can drop this thing very quickly. So I think the resolution says that we can. Sorry, that's my dog. But the resolution says we can, change or end it sooner than 60 days. So, I'm hoping that whatever the rules are, that she changes them and allows us to gather more and more with the vaccine being out, more and more people getting vaccinated. So I don't like to do that and change my mind, because I strongly don't want to do a declaration, emergency declaration, but I just can't justify it after listening to things that Nathan has said and Chris, and I don't want to burden anybody, and so I'm going to be a yes vote on this. Thank you.
Mr. Chair, let's call the question on the amendment and then vote on the resolution, please.
Are there any other comments or questions? Are you making a formal motion to call the question, Commissioner Lawrence?
Yes, I am.
So there's a motion to call the question so that we would take a vote on the amendment. Calling the question requires a 2/3 support to cut off debate and vote. Is there support for calling the question?
Support. Helserman.
There is no debate on a calling of the question. Roll call, please.
Just seeking clarification, Chairman, you're requesting a roll call on the vote to call the question, correct?
Correct.
Okay. Commissioner Lawrence.
Yes.
Commissioner Reeder.
Yes.
Commissioner Nakagiri.
No.
Commissioner Helserman.
Yes.
Commissioner Drick.
Yes.
Commissioner Zajac.
No.
Commissioner Griffith.
Yes.
Commissioner Gross.
Yes.
And Commissioner Plank.
Yes.
Motion to call the question passes.
All right, then calling for a vote on the amendment. Roll call, please.
One question, Mr. Chair. I want clarification from Commissioner Zajac that his number 3, the last 3 words will be reading via virtual meetings rather than via in-person meetings. Is that correct, Commissioner Zajac?
It should read as on the screen, via virtual means. MEANS.
Okay. Commissioner Zajac.
Yes.
Commissioner Griffith.
No.
Commissioner Gross.
No.
Commissioner Plank.
No.
Commissioner Lawrence.
No.
Commissioner Reeder.
No.
Commissioner Nakagiri.
Yes.
Commissioner Helserman.
Yes.
And Commissioner Drick.
Yes.
Motion to amend fails.
All right, so we have in front of us the main motion, and I will just call for a vote. I think everybody's got a chance to speak to the main motion, the main resolution. So roll call, please.
Commissioner Gross.
Yes.
Commissioner Plank.
Yes.
Commissioner Lawrence.
Yes.
Commissioner Reeder.
Yes.
Commissioner Nakagiri.
No.
Commissioner Helserman.
No.
Commissioner Drick.
No.
Commissioner Zajac.
No.
And Commissioner Griffith.
Yes.
Motion carries.
Thank you. Lost my agenda. So we're at item 13 on the agenda, the second and final call to the public. If there's anybody wishing to address the Board of Commissioners, please indicate so by using your raise your hand function on Zoom or just wave at us physically. If Cindy Katnick can would be so kind to call on the participants.
Judy Dobbenmeyer.
Hi, thank you. I'd like to thank the Commission for approving this resolution. I agree with Commissioner Griffith. This was made way too complicated, more complicated than it actually was. This was about mostly allowing local units to be under your umbrella of state of emergency so that they could more easily have virtual meetings. And I'm so relieved that the EMS department does not now have to manage 20 separate declarations of emergency. It just seems so disrespectful of the Commission to want to put that burden on the staff rather than simply approving this resolution. I think burdening the staff with managing hybrid meetings, having to show up in person and exposing themselves potentially to a dread disease, you know, that it's not liberty to infect someone else with another disease, with a disease that could kill them. That's nobody's definition of liberty. And it's certainly not pro-life. So I'm glad that sanity prevailed tonight. Thank you.
Thank you, Ms. Dobbenmeyer.
Can you hear me?
I'm sorry, Rick Napier. Yes, go ahead.
Okay. I just want to say that not having an open meeting and hiding in the Zoom meetings is ridiculous. It's unconstitutional. And you guys have thoroughly convinced me tonight that it's time to sell my house. And probably my best thing to do in this state, because of our state legislature not standing up for the people and representing the people, it's probably in my best interest to leave the state of Michigan and pay a lot less in taxes and just get out of here where I can have freedom and liberty. That last person who spoke, she's saying that infecting others is not liberty. Do the math. There's hardly anybody. I mean, there's less than 1% of the people are getting sick with this. You know, and my mother died from this. The reason why she died because she was treated for pneumonia instead of COVID. So this is just ridiculous. And hiding in these meetings, the way you guys are doing them is ridiculous. And my commissioner has no stones to stand up. You can see the whole night. He's been fearful of this. You guys are terrified, or some of you are terrified by the boogeyman here. It's ridiculous. Grow up, act like adults. If you can't act like an adult, step down and let somebody who will do the job. So, and part of doing the job is having a meeting and listening to the people in the call to the public. And by doing this on a Zoom meeting is ridiculous. So that's all I have to say. For those of you who stood up, I appreciate it. I appreciate the representation. And for those of you who cowed down to the governor and following suit, shame on you.
Thank you.
Cindy Holland.
Yes, I feel the same sentiment as Rick, although I don't think I'm ready to sell my house and move just yet. I think that there is definitely cause for looking for replacement for some people on this board, obviously. You guys were told earlier that the rules had been changed to 3-foot social distancing and consistently used the 6-foot rule and applied that to the conversation this evening, which was irrelevant because it is no longer there. So there's that. And then there's the other issue of 99.8% recovery rate, and that includes people over 70. Yeah, like Rick said, do the math. That's all I have to say. Thank you.
Thank you.
Yanni Kazan.
Hi. I just want to say something as far as Ms. Plank. I think you all forgot that you're representing us, and you have made a decision based on inconveniencing yourselves, you elected people. I understand this, okay? I grew up in a communist country and I came here for freedom and liberty. And when you make decisions because you don't want to inconvenience yourself, and we're willing to come out, that lady that goes out every day or whenever she goes out to get the vaccinations done and she's out in front and she's around people and does whatever, you guys didn't think about her. You're just worried about exposure within a building, within 3-foot distancing, which is all made up numbers. So you are inconveniencing us and you're representing us, which is such a disappointment for all of you. So Livingston County should be the leader in the state of Michigan of encouragement. And, you know, a lot of stuff has been said today that I will need to refute. A case is a positive test with the disease symptoms. So when they list you all these cases, it's just a positive test. They are calling it wrong. Most of those people are not symptomatic. So, you know, so many questions that I have, such as, you're giving vaccines drive-through. Do you have a system in place where you're going to watch them for 20 minutes so they don't have an anaphylactic reaction, or, you know, be able to act if they do? Are you tracking? Are people calling you to give you the VAERS data with the adverse reactions to the vaccine? How many of those have we had with all the vaccinations we're giving? Why is a vaccine the only answer when actually of the 11,500 people or cases, positive cases, that most are asymptomatic, they have immune system. They are immune. So why is it that we're using the changed, how do we get to herd immunity? It's all based on vaccination, and that's a whole bunch of bull. If you've had the disease, you've got antibodies for at least a year now proven. So you, the board, have a lot to learn, and I suggest that you start remembering, with all due respect, you're representing us. And I'm more than happy to come and teach you more of the medical side of it, but you are making decisions based on fear rather than representing us and allowing us to make choices. I chose Livingston County when I came back from the military. I took an oath of office to the Constitution, not for inconveniencing me. I went to the military and it was the most difficult time of our lives as a family. So I am so disappointed, and I thank you guys, you know, the four that were able to stand their ground and realize when West Nakagiri speaks, it's liberty.
Your 3 minutes is up. Sorry.
Thank you.
Mitch. Thank you.
Can you hear me? Hello, can you hear me?
Yes.
Okay. Yes.
Go ahead.
I'd just like to address a few things. First, Commissioner Blank, sounds like you're kind of new to this, but at the same time, something that you were addressing about your other job will let you work remotely. This isn't just your everyday job. You're voted it. You guys are representing us, we the people here in Livingston County. So it's not like you're working for, you know, whatever group you're working for. You're working for us. And a lot of us have voiced our concerns and let you all know that we would appreciate an in-person meeting. And it sounded like the gentleman, Mr. Zajac, came up with a great idea. We're doing a hybrid for those who don't feel comfortable coming in. And we're also allowing for the meet in person. Now you guys are talking about, oh, well, it's just another 2 months, just another 2 months. How many months have we heard this? I mean, this is going on 1 year of slow to spread. I mean, so when what, May comes around, oh, just another 2 months. Oh, just another 4 months. I'm tired of just another 2 months. And you guys work for us. I'm not trying to be really nasty or disrespectful, but like, you guys seem to forget who you're working for, who pays for this stuff. It's us. And I want to have an in-person meeting, and I don't see why we have to wait another 2 months for what. I just really don't understand what that's going to accomplish. And it sounds like the 4 members who voted no also agree with this. And the fact that, I'm sorry, Commissioner Plank, that you were swayed just by what, lack of staff, that's inconvenient for you guys. You guys really need to step it up a little bit. Maybe do some more research on what's going on around here. I completely agree with some of the sentiments that a few other people just before me started talking, and they were telling you the numbers don't add up. This is not a state of emergency. You have no reason whatsoever, just because your staff is being inconvenienced and you're having a hard time with the IT department, that allows for an emergency to keep going on? No, it doesn't. That's not an emergency. That's lack of staff. We'll have to figure it out. Just like with any other place that you're employed, any other thing you have to do in your life to figure things out. And we, the people of Livingston County, a majority of us have asked you for an in-person meeting with the ability for those who feel uncomfortable to show up on Zoom. I'm sorry if that sounds difficult, but you got to figure it out. And the fact that you didn't have this already in the back of your mind, because you knew it was coming. Commissioner Zajac said the exact same thing. You knew it was coming, so you didn't have it in the back of your mind that you'd have to plan for A, B, C, and D. So now you're going to scramble for these 2 months and do that?
Ms. Anjo, your 3 minutes are up.
All right. Well, thank you so much.
Sean Greer.
Hello. Thank everyone for the time put into the discussion tonight and the thoughts and the feelings and the different aspects of how it can be impacted. It's appreciated to hear the quote unquote debate and the discussion regarding it. What we're really discussing is these mandates that come from a declaration of emergency from a governor that has no constitutional value whatsoever. So if we get back to the fundamental basics of our Constitution that is not taught in Livingston County public schools, that isn't taught from first grade on, it's not, this is why we stand in this predicament today. So we're going back to a law repugnant to the Constitution is null and void. We're making all of these other mandates coming from that when that never went through legislation to get a declaration of emergency that was approved through legislation to be impact of the people. But we get back to the unalienable rights and our foundation, and that is what the oath is based on. If the orders that you're given are coming from a null and void order, then now how are you fulfilling your oath of office to the Constitution of the United States? I believe the impact that it has across the various departments is of great need to be detailed and understood with a plan of how it's going to be. But now if we say no to this, where's then the next topic point of discussion of what are you going to do in the next 30 to 60 days to make this be successful, where it's a 10-minute conversation because you already have it figured out? We have to get back to our fundamentals and teaching the values and principles that we're lacking in society within our educational system so we can truly evolve with each other. Thank you for your time, and I know it's late and it's greatly appreciated.
Thank you, Mr. Greer. We appreciate everybody coming out and voicing their opinion.
Aaron Wilson.
Greetings once again, sirs and madams. Like I said, I'm not a resident of Livingston County. However, I do understand where some of these people are coming from within Livingston County, especially Miss Anjo. I definitely share her sentiment when it comes to this because the numbers just don't add up here. I mean, what you guys are doing, what you guys are debated on is what it sounds like, whether or not you want to have people meet in person or not, or have hybrids or what have you. The way I see it, the people should have the power to decide for themselves whether or not they want to go out, or whether they want to stay in or what have you. Like I was saying before, wear a hazmat suit if you have to. The way I'm looking at all of this here is that we've come to an age now where the bad guy can win. And unfortunately, that's what happened with this motion. I mean, maybe I'm a little bit old school, but I've come to know where this age has just screwed everybody up. Unfortunately, that's happened to some of the people in office too. We've come to a time where people can complain and get rewarded. I mean, they bark loud enough for long enough and people begin to fear their bite, which the CDC did. Now there's, with Governor Whitmer, I call her the Gretch, actions without consequences. Of course, this whole mandate thing was pretty much nullified back in October of last year and by the Michigan Supreme Court. So really, there was no state of emergency since then. I mean, there's inflated numbers. Everybody knows that. Even Judy knows that, I'm sure. But unfortunately, insanity took the cake on this one. And unfortunately, so did gross ignorance. I'm with Rick when I'm ready to just get out of this state entirely, unfortunately, because that's what a lot of people are doing because of this. And that's all I have to say about this. And thank you, sirs and madams.
Thank you.
Stephanie, Craig. Stephanie,
She's muted.
can you unmute yourself? Okay, let's go over to Eva Helmanen.
Hi, can you hear me?
Yes.
Thanks. I initially had my hand up and then I took it down because several others had the same sentiments. But then I was thinking about how I've lived my life through this whole ordeal, and I just had to share it with you. Initially, our church closed, as most churches did. And then after several months, when we were allowed to make our own decisions, our church opened. We have a very large congregation. We have old people, we have young people, we have middle-aged people. We have people that wanted to fellowship. And we opened our church, and on every single Sunday, there's probably 1,500 people minimum in our church, and we have had 0 deaths. Have we had COVID? Yes. My parents don't belong to my congregation. They live up north. However, they both had COVID. They're 84. Because of the will of God, they did not pass. They did very well with it, I might add. So the way I look at it is we should actually study ourselves, not listen to exactly what the governor is telling us. We should use our own intellect, our own research, our own wisdom, and make our decisions based on that. We have elders in our congregation that have chosen to listen to services because they understood that it was their choice, their decision on how to proceed, which as a congregation, we all are for that. We believe that it's an individual's right to make that decision, how they want to proceed and protect themselves. I'm not saying this to brag about our congregation. I'm just saying it's a good case study because we have had 0 deaths in a very, very large congregation. And we have a large Sunday school, and we believe in people being face to face with people, not being virtual, and as others have stated, hiding in our basements. Let's get over this, people. It's something that's never going to go away. The flu never goes away. It's never gone away, except for this year, of course, because of COVID. And I just want to say thank you for your time. Thank you, everyone, for your thoughts. And thank you for allowing me to speak.
Thank you for joining us.
Let's try Stephanie Craig again.
Thanks. And I think this is some of the problems with Zoom. I just want to say you're discriminating. You're discriminating against people, the elderly, that don't have access to Zoom. People don't have access to this technology, and they are not allowed to participate in these meetings. And I'm speaking on behalf of 3 people that came to our protest tonight in front of Lawrence Auto Body that was stating that we should really declare the emergency null and void. There is no emergency. There's no emergency. There's no emergency. I didn't hear anything about people's deaths. I didn't hear about people dying. All I hear is the vaccine will save us. No, it won't. No, it won't. The vaccine won't save you. And another thing, there was a lot of suggestions people made. Meet here, meet there, meet there. It is not our fault if you guys were not prepared. That is not the public's fault. That is your fault. The fact that the state of emergency declares a travel ban, no one is objecting to that on that grounds alone. A travel ban. You guys just approved a travel ban. Oh, we'll never do that. We'll never do that. Just stay home for 2 weeks. That's what you guys told us. Just stay home for 2 more months. Don't come to our meetings. Do you realize what you're saying? You guys that voted yes, you did not speak of our liberty, our right to gather, to congregate, protected by the Constitution, like the last caller said. And I'm with the one guy that says he's going to move out of here. That's what people are doing. They are leaving in droves. They are not going to take this tyranny any longer. You guys just declared a state of emergency. Well, my government officials wanted me to. That shows who your allegiance is with, not with we, the people that voted you in, but the people in the government. You guys should be ashamed of yourself. And Jay Gross, I actually voted for you, and I'm grossed out by myself that I did. Grossed out by myself. I cannot believe that you are so scared. Like the other caller said, if you're scared, stay home. Quit your position. Don't do it. Wear a hazmat suit. 5,000 other things. Come on, seriously. My daughter isn't even scared and she's 5. The other comment, if the health director tells you to go take an aspirin, are you going to take an aspirin? Where does it end? Stand up to the MDHS. Come on, you guys. If your friend tells you to go jump off a bridge, are you going to jump off a bridge? So if the health department comes in and tells you to jump off a bridge, you're going to jump off a bridge. You're going to wear 3 masks. You're going to stand 3 feet apart. If I see you guys walking into that building and you're standing 2 feet apart, I'm taking a photo and I'm calling you out. That's all.
Thank you for joining us.
There are no other hands raised. Is there anyone else from the public who would like to say something?
I see a hand raised, Janine Flyer.
Okay, thank you, Commissioner Hauserman. Janine, I am trying to unmute you. There you go.
Hi, it's Janine Iyer with an I.
You can go ahead.
Yeah, okay. I just want to express my disappointment. Yeah, I just wanted to express my disappointment as well at the elected officials that ignored their constituents who so passionately expressed how their lives and the lives of their children and people in their lives have been affected. You may not think so, but declaring a state of emergency has ramifications beyond yourself. It affects the psyche of everyone in our county, I'm sorry to say. And I also just want to thank the 4 commissioners who voted to have in-person meetings, because the people in this county want to go back to normal. There are many reasons to believe that we can go back to normal. And yeah, I just thank you for your time tonight, and have a good evening.
Thank you.
Is there anyone else from the public who would like to say a few words? Commissioner Nakagiri, I do not see any other hands.
Okay, thank you, Cindy. So I'll close the call to the public and ask for an adjournment. Is there a motion to adjourn?
So move, Helserman.
Support, Zajac.
A motion by Helserman, support by Zajac. Roll call, please.
Commissioner Helserman,
Yes.
Commissioner Drick,
Yes.
Commissioner Zajac,
Yes.
Commissioner Griffith,
Yes.
Commissioner Gross,
Yes.
Commissioner Plank,
Yes.
Commissioner Lawrence,
Yes.
Commissioner Reader,
Yes.
Commissioner Nakagiri.
Yes,
Motion carries.
we are adjourned. Thank you, everybody, commissioners, public. Really appreciate the participation. And